innovation. To our panel of judges, they may represent investors, they may represent prospective CEOs, corporate partners, customers who need to be persuaded for them to join your team or for them to part with money or enter into a commercial deal with you. And I'm now going to ask each judge to introduce themselves. So our head judge, John Wood.
Oh, yeah, but I was the head judge, but anyway, welcome. I'm a fellow here, an academician. I used to be head of engineering at Imperial College, and I've got my own companies. I'm a consultant to the big labs in Europe, such as CERN and European Molecular Biology Labs, on really trying to get innovation in this area of sensors, instrumentation and data handling. And I'm also a consultant to the European Commission on research, and I used to chair the main research board of the Commission.
Good morning, my name's Cliff Danso. I'm a lecturer at Kingston University, but prior to joining academia a couple of years ago, I was what's known as an incubation manager for about 25 companies who were bringing new and innovative low-carbon products to the market. And my job was to orchestrate and help with their commercialization.
Hi, I'm Alexandra Love, and I've been involved as a mentor on this program. My background is takes me a whole range of various professions, from academia to consultancy, investments, and commercialization of innovations. Thank you.
Thank you, judges. Okay, so if I can also introduce our timekeeper, Pete Moores. Pete. I'm not sure he deserved a clap, but anyway. Pete has a 1-minute sign, pictures, a 30-second sign, and a finish sign. All right, okay. Steve is looking after our AV this morning. And fellows, you will be competing within and amongst your team members. So each fellow from each country will be competing against each other. So we will have a winner from Thailand and a winner from Vietnam. You will also see a film crew in this room. So please be aware that your pitches will not only be heard by people here, but also across the internet. I will announce who is up next. I will also announce the pitcher who will follow. And so when you hear your name to come up and prepare, we'd like you to go over to our AV area and make sure that you are mic'd up and ready. Okay, the rules are simple. You have 3 minutes to pitch, and then you will have up to 4 minutes to answer questions and receive feedback from our panel. Any questions? Okay. Let the pitching commence, or do we have a question? Go ahead. Okay. So the computer is there, and the clicker is here. It's very simple. It just has a next and a back button. There's no laser pointer. All right. Any more questions? Yes, we would appreciate it if you would stand around this pink cross here where I'm standing. Please make sure you're this side rather than that side. Okay. Thailand, you will compete first. The first pitcher is Ammorn.
Yes.
Ammorn will be followed by Noppadol. Please, fellows, give a big round of applause for our first pitcher. Okay, Pete, you ready? Ready. Judges, you ready? Ready. Ammorn, you ready?
Yes, I'm ready.
In your own time.
Go. Good morning, ladies and gentlemen. My name is Ammorn Insung. Today, I want to tell you about my company. We manufacture the high efficiency and eco-friendly pesticides. Thailand is one of the largest chemical pesticide import country in the world. Heavy use of those pesticides cause many problems, harmful to the growers, the consumer, and environment, and definitely it's induce pest resistance. Pests are natural products based on biotechnology and nanotechnologies with high effectiveness, easy to use, and safe for user and nature, and with no pest resistance. We have three forms of applications to treat with a wide range of field crop and household pests. We have also certificates or regulation of safety to use the products in different areas or different locations. And our products, our technologies is protected by 12 national patent applications. We manufacture many products and selling via sales agencies and directly to the farmer as safety farm or smart farm. And we also make a contact with service agencies and for who control pests for the hotel or warehouse of the industrial sector. And now the current revenues is about $500,000 US a year, and we expect to turn over $15 million within 5 years. In the future, we plan to sell the product in the supermarkets where domestic user can buy its convenience. As a part of expand strategies, we would like to sell our product in European Union or efficiently here in UK, and we are looking for appropriate strategic partner, and we hope that one of you here can be our partner. Our team divided into two sections, research sections and product and sales sections. We are working as a local company. Finally, I would like to thank to all sponsors and thank you for your kind attention. Thank you very much.
Well done, Ammorn. Okay, so judges, you ready? There's a microphone there. Please use the microphone to ask the questions, yes. And your questioning can start now. Okay, well, I've got the microphone, so I start, I think, is the as you probably know, though, in this country and other countries in Europe, yes. There's an attempt to reduce the amount of pesticide. Yes. And you're trying to bring in a new product into a market that's decreasing yes. in this country. And also there was great worry about the effect that such pesticides have on rivers and yes. things like that. What sort of safety analysis have you done to show that you would meet the market regulations in Europe? Yeah, we have recognition for safety. We have tests with FDA in Thailand, Food and Drug Administration already, and they allow us to sell the products. It's skin test in Thailand. Yeah, in Europe, maybe I have to make a contact with someone here. We cannot do it here in European. We have to contact someone as a partner in UK. Okay, thank you. I have a question. I wanted to ask, have you done some research on the competition and other products that are on the market in Thailand, and especially if you want to come to Europe as well? Yeah, we have compared with chemical, and sometimes it's the same, and sometimes it's better, really better. And to compare with another botanical herbicide or pesticide in Thailand, I think, yeah, because very few products in Thailand and cannot be commercialized. But this is the first one product that can be commercialized with FDA regulation. Okay, thank you. Thank you.
You make some assumptions about that your market wants your product. Yes, have you conducted any analysis as to whether or not that assumption is correct?
Yeah, I think it's worked because of now that in Thailand, we have many problems with chemical pesticides, and we can say that a lot of agricultural product contaminated with insecticide. And if we use my product, the price is getting higher, and they need very much so. I would like to solve their problem, so this is my work. So I would like to research on botanical insecticide or pesticides.
Thank you.
Okay.
You said you had 12 patents.
Yes,
Do you have
application only.
They're just early filings, are they? As you probably know, to have 12 patents worldwide,
yeah.
Coverage will cost an awful lot of money, a large amount of money to defend.
Yes.
Are you able to do that, or would you be better finding a partner who will take the costs from?
But because in our country, to put a patent, the cost to put a patent is very cheap. And in case of convenience part sector, government part section, we will not pay for to put the patent. But for the problem worldwide, it takes a lot of money.
Yeah.
So right now we cannot do that. So we have to negotiate with a partner here or European country or somewhere else.
Right. Okay. Any other questions? No. I think we're done. Thank you very much.
Okay. Thank you.
Okay. Well done. Thank you, Ammorn.
Thank you.
Okay. So our judges will complete their consideration of our first picture, and then we move on to our second picture, Noppadol. Our picture after Noppadol is Atchara. Please get yourself mic'd up at the back and prepared. Okay, fellows, please welcome Noppadol to the stage. Okay, judges, you ready? Pete, you ready?
Yes.
Noppadol, in your own time.
Okay. Good morning, everyone. My name is Noppadol, a researcher from Nanotech, Thailand. Have you ever experienced chest pain? My father did. Firstly, I thought he just had a hard time to breathe because he's allergic, but his condition was getting worse. Then I need to rush to the hospital during the night, and the doctor can save his life. It would be better if we have some things that can actually screen for the heart attacks as soon as possible to make help us to make the good decisions. Every year, millions of people visit the hospital due to their chest pain, but only 10% of them actually have the heart attacks. With the current technology, the EKG gives too much false positive. Blood tests take longer time to get the results and expensive. With our QuickSense biosensor chip, user can just drop the blood on the chip, put into the reader, and get the result within minutes. It's simple to use, and it can be used in ambulance, emergency room, even at home. Our target customer are ambulance providers and the emergency room. With the use of the QuickSense biosensor chip, doctor can provide proper treatment on time to save the patient life. It helps to reduce the unnecessary treatment costs and save the trip to the hospital. It's lower cost solutions. With about 250 million people experience chest pain every year, we expect the first sale in 2022 with 100,000 pounds, and with the growth rate to 3 million pounds in 2027. What we achieved up to date, we have one prototype tested in human serums, and we have 2 patent application filed. We asked for $500,000 US for the grants or investment for the design of the portable reader and pilot lot manufacturing for the field test. No worry, save patient life. With the QuickSense, anyone can test anywhere and anytime. Thank you for your attention.
Well done, Noppadol. Okay, judges.
Well, I suspect I'm the oldest one here, so I've probably got an interest in this more than other people.
Okay.
But I'm just thinking of the scenario. You're suddenly feeling ill, and you think, where did I put the test? You know, it's very unlikely you'll be thinking first about the test. How are you going to? I mean, presumably everybody's got to have one of these tests things in their back pocket. I mean, I can't see the logistics of how this works.
Oh, okay. Because our target customer is going to be ambulance. Like when you've experienced
You already had a heart attack.
Yeah.
Well,
but
I think you know you've had it then.
Yeah. But sometimes even if we are developing the heart disease, we can get ready to buy it from the drugstore to have it in our home. That is very simple. And another one is to equip in the ambulance or the emergency department, because the doctor or the ambulance staff can actually screen whether that people actually have the heart attack or not, because only 10% of the chest pain people only have the heart attack. That's why we can reduce the unnecessary if the patient is just probably the hard time to breathe, then just don't need to go to the hospital, just stay at home or do some prescriptions.
I mean, there are quite a lot of these sort of tests, which often depend on a drop of blood or something for blood sugars and other things. What is unique about your technology?
My unique is to compare with the electrochemical sensor that used for the glucose. It's more sensitive. It's 1,000 times more sensitive for that electrochemical. This is a nanoribbon field effect transistor-based biosensor.
Right. Have you ever thought of using enzymes instead of an electronic system?
Oh, actually, I cooperate with the enzyme in order to boost the sensitivity to be the 50,000 times more sensitive than the blood test in the hospital.
I think I've asked enough. I run a company within this field.
You mentioned a timeline for development and deployment of your technology. Can you give a little bit more detail about the approval process for actually being able to use the technology? Oh,
because this is the timeline. Firstly, I want to collect all the field test data before I went for the product registration with the Food and Drug Administration. It depends on how strong the data is, then how we gonna convince the panels. Yeah, we probably plan to hire the registration consultants to help us to move this process quicker.
And I have a question about the patents. So you've mentioned you filed 2 patent applications. Yep. Did you file them in Thailand or are they worldwide?
I filed in Thailand because right now, yes.
Okay, and the next step is, because obviously this technology is applicable to other countries. Yep. Where there are big markets. So is your aim to file in other territories as well?
Yes.
Okay, great. And are you planning to, in terms of your business model, are you planning to sell your products initially in Thailand and then go abroad?
Yes.
What are your plans?
I plan to sell in Thailand to get a market record first before I seek partner from other country, and then probably gonna ask the partner to help me to file the PCT application later.
And in terms of the Thailand market, so the cost of the actual device, have you looked at, okay?
Yeah, we have prepared for that. In Thailand market.
Okay, judges, I'm sorry.
Yeah. Okay.
That's enough, please, everybody. Well done.
Thank you.
Okay. The judges are getting hungrier and hungrier for more information. Okay, right, so next up is Atchara, and after Atchara, we will have Ratthaphol. So please, Ratthaphol, get yourself mic'd up and ready. So, fellows, please welcome Atchara. Okay. Judges, you ready? Pete's ready. Atchara, please.
Good morning, ladies and gentlemen. My name is Atchara Poomee from Managing Director from Pat Corporation Company, Thailand Company Limited. Do you know that in tropical countries, air conditioner is one of the most energy-consuming equipment? And it is interested if your water heater can reduce the electricity bills, monitor electricity consumption, and working performance. Right now, we developed Pack-Free heat recovery water heater, and it had already sold 2,000 units to the market. And this is the picture we installed the product. We have received many customer references, awards, and technology testimonial from domestic and international institutes. And this is our team member who involving with the achievement I mentioned earlier. Right now, we are developing another technology, which is IoT monitoring for the air conditioning and other equipment in the hotels. Because we are in this business for almost more than 10 years, and we found the problem that the properties that don't know about the individual units, building, guest room, energy consumption. Then we develop this and expand to any other equipment devices in their rooms or their buildings to collect the data about consumption, temperature, usage, and also for water, and get them data to their energy management for their properties. And this is a target customer, it's same as Pack-Free Energy, the first product, which is a 4 to 5-star luxury hotels and resort. And this is our minimum viable product, which is energy saving, maintenance cost saving, reliability of the IoT system, and data for hotel management. Our research, we have a total accessible market around 42 million US dollars alone in Thailand and the Maldives, and further on another market globally. For our revenue model, we have two models. One is for selling directly the product and services to the customer. And another is we try to develop ourselves to be a software as a service company and charge the customer in monthly fee basis. And this is our expected for sales for Pack-Free Energy for 7,000 units and Pack IoT for 20 systems by year 2020. And this is the cost saving. I'm come here to seeking for partnership for product development in IoT technology, business development in distribution, and money for investment for product and business development for 600,000 US dollars. Thank you very much.
Well done. Well done, Chara. Right on time. Okay, judges, please, questioning.
Thank you for your presentation. Could you tell me how would it actually work in terms of you obviously get all the readings of how your systems operate and it goes back to the owner of the property. How do they manage it? How do they reduce the energy usage?
By the IoT technology, right? Yeah, right now in the big building, which install the chiller or VRF system, they have their own monitoring system. But in individual split type units, they have no system yet. So we will go to put a sensor into each equipment. With our technology, we will monitor the equipment via internet. And then we collect the data while it's turn on, turn off, or using, and then processing the data to the cloud, which is one of our partner technology, and then process everything and send the data back to the customer. So.
Thank you very much. Why $600,000? What are you going to do with $600,000 as part of your development plan?
Yeah, for 100,000 US dollars, we'll go for the product development, which is the IoT development and testimonials. For the pilot test of the product. And another 5,000 US dollars is for go for marketing our first earliest product, because right now we do it by our funding, and we we think that they have a lot of opportunity to expand the market to globally and nearby countries. So that is the fun for marketing.
Is your model based on selling a service or selling the hardware? And if it's selling the hardware, how are you going to license people to make sure it's up to your quality standard? And also, too, how are you going to provide security on the data that's coming out of this? Because obviously, people are worried very much about cybersecurity, and big companies be very worried because it will be an indication of the room usage rate that could be actually accessed by other competitors.
Yeah, it can be explained in two parts. One is about the hardware. The hardware is for the product-based product, which is the Packfinergy, that one. We sell it one by one unit. By the selling model is for direct sale, direct selling the product. And another part, which is the IoT, we will selling by the services. And firstly, we will plug on with the hardware-based product first. And another phase is we will individually sell it as a software as a service. And for the security function, because of this is my first time entering in this market, so we right now work a lot on that issue and securities about the data and privacy of the customer. I have to work more about that and have to concerned about this later.
Would you see your model and the data being used by companies for their annual report to show their carbon footprint? Because there's going to be more legislation to do that, certainly in these countries here, although we don't have the same problem that you do in Thailand.
Yeah, it's a very good idea. I didn't think that before, but because of this is our first phase of development, but we already done there with our Packfinergy one for the carbon footprint, and we will develop this as your suggestion. Thank you very much.
Thank you very much.
Yeah.
Okay. Atchara, thank you. Great. Okay, so our next pitcher is Ratthaphol, and after Ratthaphol we have Sirida. Okay, so Sirida, please get yourself mic'd up, and Ratthaphol, please come and stand on the pink X. Okay, so your slides are ready.
Yes.
Our judges are ready. Pete's ready. In your own time.
Hi, everyone. My name is Ratthaphol Charlermroj, researcher from biotech in Thailand. Would you rather eat this cantaloupe or this one? The ugly ones become from the infection of the plant pathogen. This pathogen could be found in the vegetable seed. The market of the vegetable seeds was so huge, and which was accounting to $4 billion US. However, about 20% to 40% of crops lost to diseases. And these diseases affect to the farmer, seed supplier, and also the environment because it can cause around the world. So to prevent this disease, we developed the test kit, namely Plant Beat, by collaboration with the different team in our institute in Thailand. And this test kit provide a multiplex assay to detect 4 pathogens. The commercial test kit ELISA, they require 4 samples. Moreover, each pathogen detection is used a different assay format. Therefore, it is time-consuming and also the labor-intensive. Our Plant Beat, it can be detect simultaneously 4 pathogens in one sample. So it is easier, faster, and low sample requirement with the high specificity, sensitivity, and accuracy detection. In this year, we sold 1,000 test kits to the seed company in Thailand already, and we have the pre-order from the company in this year as well. So from today and to the next 3 years, we have planned to expand our product into the Asia and Europe. And we also offer the assay development services to enable to develop the new test kit for the clients. So our team, our team member are the researcher. So we want to drive our product to around the world. So we would like to ask for the commercial partner to expand research, our research into the regional seeds producer and also export the international markets as well. So thank you very much.
Well done. Well done, Ratthaphol. Okay.
Okay. I assume I didn't understand what the technology was, although, again, it was enzyme-based, which I am quite familiar with. But are you just taking samples of seeds? And what sort of sampling rate do you take? And what sort of statistical certainty do you need before that batch of seeds is destroyed?
You mean for the sample population?
Yeah, I mean, you can't test every seed.
Yeah.
I mean, otherwise it'll take years, but...
in this product, we focus on only the cucurbit plant. Mm-hmm. For example, the watermelon seed, melon seed, and the cucumber seed.
Yeah, they're big seeds, aren't they?
Yeah. And for the sample population, we just grind it and then take a supernatant and test with our products.
So you're just taking a sample. How many samples do you need to take in order to have certainty? That's really one.
Usually we use 10,000 seed. Mm. Yeah. And then ground it and use only 50 microliter.
Right.
Yeah.
Is your technique applicable to very small seeds as well?
Yes,
Okay.
exactly.
Thank you.
So do you consider that the 20% of food waste that the world's experiencing at the moment could actually be dealt with in total by your products if your product was applied across the board, or is it that your sampling method you would only actually ever be able to achieve a certain percentage? Do you have an idea as to what degree of value you would actually bring?
What degree? Can I say the competitor first? For the competitor, right? Sorry, can you repeat that question again?
I was just asking, considering that the amount of food waste you quoted as 20%, if your method is applied, will it eradicate the waste, or because of the sampling method, do you think you will only achieve a portion of the value that's potentially available to you, as in that 20%? Are you going to do it all, or are you just going to do a bit of it with your sampling method?
We're going to supply only the reagent, and also with the asset development services. Yeah, sorry, I'm not...
No problem. Thank you very much.
Just a quick question. When you said you're looking for commercial partner, are you looking for licensing, or is it going to be a joint venture?
I'm looking for the business partner because our team, we are only the researcher, so we don't know about the marketing, about anything else about the business. So we would like to invite the business partner to help us to sell our product around the world.
Thank you.
Thank you.
Okay, judges, thank you. Thank you, Ratthaphol. Okay, so next up, we have Sirida. After Sirida, we have Kun. Perfect. Everybody's ready. Okay. So, please, everybody, welcome Sirida. Okay, judges are ready. Pete's ready. Sirida, you ready?
Yes.
Okay, go ahead.
Good morning, everyone. My name is Sirida Youngchim. I'm from Thailand. Today, I would like to introduce my product. It's a rapid test to detect Penicillium anaphylae antigen. This test is very fast, accurate, and very easy to use. I call this product is PM strip test. Do you know 40 million of people in the world living with HIV infection? And Southeast Asia is the second largest area of HIV patients. Today, we have 5 million patients who got HIV infection. And these patients have died from opportunistic infection. One of the most important of infection is Penicillium anaphylae, which is an endemicity in Southeast Asia and southern part of China. So these patients, if they get delay or misdiagnosis, they will be dead. Today, this disease is diagnosed by using culture method, which it takes 2 or 3 weeks to get the result. And my product, PM strip test, can solve this problem because it takes only 20 minutes to get the result, and it's very easy and friendly for user. And this is my product. You can see that if the patient gets infection, we got 2 bands. And in the opposite, if 1 band, it means that the patient without infection. This test not only very easy for user, and it's highly specificity, sensitivity, and accuracy. And this work is supported by Ministry of Public Health in Thailand in the year 2017, and I also applied for patent. And for milestone of my work, I want to bring to the market and then distribute to community hospital in Thailand and then to other countries of endemic city like Vietnam, Myanmar, and Cambodia. And also I need money 300K pound to to market my product and for employee and so on. And also I want to licensing my product and contact to fungal test producer. And this is my team. Thank you.
Well done, Sirida. Okay, judges.
Thank you very much. So you've mentioned the alternative technology is the culture methods.
Yes.
So have you done some research and looked into other potential technologies, other ELISA sort of methods, or any other methods on the market?
Yes. I try. You mean in the market? Yeah. In the market, now they don't have any available rapid test for this disease. And because we don't have, and some lab try to use other tests like ELISA. We call galactomannan to detect the fungal, but it get very high cost reaction. And now we don't trust this test anymore, and it's very expensive for my country, the developing country. It takes about nearly $20 per time. And it's very expensive for most of our country.
Thank you very much. What's your plan to commercialize the product?
What I plan? I'm looking for the test, fungal test producer. If we can make a lot of product, and then we can distribute and sell in Thailand, and should be not expensive because we are really come from a developing country.
I appreciate it's a chromatography technique, effectively,
yes.
Isn't it? So 2 things really. One is, what is the sample that's taken from the patient? You know, what is it? Is it some saliva or what is it?
It is urine.
It's urine, is
urine,
it?
and then, yes.
Okay, and then secondly, what sort of quality control do you have on the strips? Because that seems to be one of the more difficult things to ensure that they're the same quality all the time. Have you done quality assurance tests on the production of the strips?
Yes, we do. We have done, and we use, you mean with other sample with
Yes, that's right, because I mean, I'm slightly familiar with these type of strips,
yes.
And I know there can be some variation in them. That's why I asked the question.
Yes, we test a lot. It's a pilot study for, I think, nearly 500 samples.
Right.
And then it's...
and what would be the cost of one piece of, you know, with the electronics and the strip, what would be the cost? This is presumably in a hospital or doctor's surgery you have the test.
Yeah, you think...
What would be the market? If I was a doctor and I wanted to buy one of your pieces, what would it cost me?
For me, I think I just not over than $2.
For the whole, the equipment and the strip?
Each, just one strip.
Just one strip, but
yeah.
What about the electronics that you need to read it?
And it's just a strip like a practice.
Yeah.
You just dip it and it shows 2 bands, that's all.
Oh, I see.
No
You
need.
showed a piece of...
No, it's no need any equipment.
Okay.
It's
Well,
like a practice.
Sorry, I misunderstood. Thank you very much.
Okay.
Well done. Okay, so next up we have Kun, and after Kun we have Panida. Panida would like to go and get herself mic'd up. Okay, Kun, welcome. Please give her Kun a round of applause. Okay, so Kun, you look happy. Judges, you happy? Pete, you happy? Kun, after you.
Counter Innovation, nanotechnology platform for drug delivery. We are getting old, and when we're getting old, we notice something is changing. Something very obvious is our skin. Aged skin and premature sun-damaged skin cause wrinkles, and as a young woman, we like to avoid that. We like to prevent it. We use the facial creams, but we did a market survey, and it said that up to 75% say that it's not effective enough in wrinkles. Or we can go to beauty clinics, have a Botox injection or filler injection, but it is painful. And if you are like me, I'm really afraid of needles. Injection is not going to be my option. Our technologies offers solutions based anti-wrinkle skin patch. It is 5 active ingredients packed in nanoparticles. We put it in tiny needles made of polymers that you put it onto your skin. It dissolves within 5 minutes and delivers molecules to stimulate collagen production. Compared to filler injection, it is painless, more convenient. You can use it at home at any time by yourself. And it is more effective compared to conventional cream. This is the prototype. Up to date, we have received $40,000 for formulation, some feasibility study, and we have come this far with a great team. We have Diep as a CEO, she launched a company before, and I am Soracha. As a CTO, I will have more than 8-year experience in nanomedicine research, and Wasavat has experience in digital marketing. It is a large market opportunities. It is more than $12 billion only in Asia spent on anti-aging products. And our target potential is in Thailand in the first years, more than $500 billion spent each year. First, we will focus on female millennials. This is an early adopter, like to try new things. We are raising $225 in exchange of 18. This money will be used for clinical trial, batch manufacturing, any activities that make us ready to launch the product in 2020. And we'll launch through e-commerce website, pop-up stores in the big city, followed by a beauty clinic and drugstores. In conclusion, we have a nanotechnology platforms that can deliver any molecules for and we are working on some more serious problems like infection disease and cancer that take long time in research. But we hope that this will be a starting point that can help more patients in the future. And the lead product is the compound that stimulates collagen production. And again, we are raising money to move this into full commercialization, and exit strategy with most likely will be trade sales in year 5. Thank you very much. Counter Innovation, nano delivery platform for drug delivery.
Well done. Well done. Perfect timing. Okay, judges.
Okay, well, I think I'm past being helped by your product. But what about the application of it? Because are you actually producing the nanochemicals, if I can put it that way, or are you producing the very fine needles, or what is it you're actually producing? Or are you putting them together and then marketing?
Yeah, we produce, the final product is skin patch.
Yeah, I understand.
And within that patch, we have tiny needles.
Yeah. But do you make those needles?
Yes,
okay.
Yes. Everything all as a final product.
Yeah, I understand the final product, but are you making the patch itself or just the chemicals that go on the patch?
Chemicals can be purchased, but nanoparticles, we have to synthesize and put it in the needles.
Now, I mean, people are very concerned about putting patches on their skin and things because of adverse reactions. I mean, I know myself, various creams react badly. So but how do you know, what sort of testing have you done to see what the reactivity is to your product?
Yes. So first of all, this will be made from 100% natural biopolymers. These chemicals are naturals, and it is FDA-approved polymers.
Right.
And to answer your question, we have to do clinical trial in the very first phase to test safety.
Now, doing clinical trials is very, very expensive, as you probably know. So how are you going to go from where you are now to full clinical trials? Because that's a lot of investment by somebody.
Right. So I work in the hospital as a professor as well. And for the very first trials, we can work within university hospital. That's the potential partner, the key partner for us. They are able to help us through clinical trial phase 1. And that within the government partner is cheaper than outsourced to other hospital.
There's quite a lot of skepticism about aging creams and the like.
Right.
On what basis, or how are you going to convince the end users that it actually works?
As of market strategy, we think about influencers. So we send a sample product to influencers over internet. They use it, try it, and hopefully that their followers will receive the message that we're trying to send. That's the marketing side. But scientifically, we test in the cells. We hope that we got a positive result in clinical trials, and that will be a concrete evidence to convince the end user.
So you've mentioned that it's a platform technology which can also be used for drug delivery. So what expertise do you have in that area, or are you looking to out-license your technology in those areas?
So I have worked with infectious diseases, antibiotic resistant infection, and cancer since my PhD, and also along the way. I have really high hope that I could still work on that, but for pharmaceutical side, I would be licensing the patents because it takes a lot of money. We might work on large scale productions, make it ready, clinical trial probably, and again we could exit with trade sale to pharmaceutical industry at the end.
Okay, we're good to go. Thank you very much. Thank you. Right, so next up we have Panida. After Panida, we have Nick. Please get yourself mic'd up. It's going very well so far, Panida.
That's me.
We're doing well. We're doing well. No, I've got every confidence in Panida. Right, okay. Judges, you ready? Pete's ready. Panida, in your own time.
Okay. Hi, everyone. I'm Panida Prompinit. I'm from, I'm a researcher from Nanotechnology Center, Asst, Thailand. And I'm going to tell you about my innovation journey, and also I'm looking for the collaborations in my innovations. So, as you can know that global warming around the world, and it's affect the people, human beings in many countries around the world. But do you know that it seriously affects the eggs? And here, I'm going to save the egg. Well, the chicken, produce eggs, but at high temperature environment, it's caused suffering and death in the chickens around the world, and also it's reduced the eggs production by up to 30%. And the farmer decides to solve the problem by using the cooling pads to generate the cold air inside the farm. But, well, when they use uncontrollable water quality in the farm, so the scale will form, and then it will lower the efficiency of the cooling pad system. And now we offer the technology, we offer the chemical solutions, including the simple coating process to build up the new cooling pad with the scale resistance properties. So we call as windy pads. And the windy pad itself shows more advantages over the commercialized pads in the market currently, in terms of it can reduce the scale formations up to 40% with longer lifetime. Moreover, it can help the farmer to save their energy costs, electric bills, I would say. And also, it can help the farmer to save the maintenance costs, especially for buying some chemicals, and also it rather impact the environment as well. And I focus on the market in Thailand as the first model. We found that we potentially get the end user for over 3,000 chicken farms, but they can produce just only 1% of the egg productions around the world. And we can see that in the market in the world, well, we found a lot of opportunities to go to the market to see our customer and also the end user. And we have the research team with different expertise. We are available to help you to solve the problem. And we have the collaboration with the industry who can help us to scale up the pilot prototype. And we are here, the Winnie Packs. We need the collaboration to use our products to try in different environments, applications, and, well, in the different areas. But we still need to clarify our licensing, the business models for exploitation. Here, the Winnie Packs offer you the new innovations for sustainable farming to save money, energy, environment, and more importantly, I can save eggs. Thank you very much for your attention.
Brilliant pitch. Well done. Well done. What a great pitch. Okay, judges.
Thank you very much. Interesting presentation. So in terms of the stage of your technology, you've mentioned you have, is it the first prototype? Have you tested it in terms of comparing energy savings with other existing technologies?
So the first prototype, we got the operating prototype, which has been tested in the real environment for the 1 year, but it takes longer time to build up the scale. It depends on the environment. And from that, we found it shows quite good result for the reduction of scale by up to 40%, and then we try to make the estimations of the reductions, and also try to calculate the cost that they use in this chicken farm, that we got the result, that one. Yeah, so, but we need to try in the different area as well, yeah.
Yeah, sorry, I think you sort of covered it, but I wasn't all that clear. What value would the farmer perceive for your product, considering how much they're going to spend on it?
What the farmer gonna save?
How much is the farmer going to save, or how much extra is the farmer going to get out of having your product?
Well, I think at least they save for the money for the electric bills up to 30%. Yeah, because so they don't need to shut down the farm to clean up the older system, the cooling system. Yeah, so longer time for using that. And also they save the money in terms of the maintenance cost, the labor. So from in general, they will clean up the cooling pad 3 times a year. So from here, we can reduce it, I mean, from our result at the beginning, so we estimate. So roughly 2 times a year. So that means they reduce the maintenance, labor costs, and the chemicals. So for the chemicals, they can avoid to use it to remove the scale formation on that. So it's quite pretty good, yeah.
So these are pads like a duster that you clean your cooling with, is that right? Have I got that right?
Actually, I use the chemical to coat the pads.
Yeah.
And then it will repel the scale, I mean the ions.
So the pads are just pads, and then you
just pad and coat it, and will stay there and not released to the environment.
Right. Okay. Now, these are reusable pads, or are they disposable pads?
It's disposable pad.
Okay.
Yeah.
Now, is there any environmental implications of disposing pads with your secret brew on?
Well. You mean the environmental impacts when we just dispose it?
I mean, here you cannot just get rid of chemicals. You have to do it properly. So are there any implications of disposal?
Well, normally, because of we concern the environmental impact. So the chemicals that we use here is it's quite safe. Mm-hmm. Yeah, it's quite safe. It's some kind of the composite thing. So, but it's quite safe. And also, we did check the DMS, all the informations of that. So we can dispose these, and it will degrade in the environment. So normally, when the scale form and stick onto the cooling pad, it looks like the corals. So they just put it, and then
I understand I know they'll just throw them away, but if you have enough of these things, they can build up. But also too, why do you actually need to clean? Why do you actually embed your chemicals into the cooling system by ion implantation or some other technique?
What do you mean, say again?
Well, you can make bioactive surfaces, which will make sure the scale doesn't form. So, I mean, it's much more expensive, but you don't have to keep cleaning.
Oh, you mean remove the ion from the water or pretreat it? Oh, we did talk to the end user, and then they said, well, I don't want to increase the cost of the production cost at the beginning because our country is quite well in the rural area. They don't need it. They just, well, the cooling pad itself is still cheaper.
Yeah, I understand. Yeah, it would be.
Yeah, they just avoid using that. Yeah.
Thank you very much.
Thank you.
Okay, we're done. Thank you, Panida. Thank you very much. Well done. Right. Next up, we have Nick. And after Nick, we have Juthamas. They all know their order. They're brilliant, brilliant cohort. Right, so Nick, you're ready. Our judges are ready. Pete's ready. Nick, in your own time.
All right, everybody knows this is Steve Jobs. But most of you probably don't know. This is Lisa Brennan Jobs, the daughter that he denied. Even after taking a paternity test, Steve still claimed that 28% of male population in the US could have been her father. But that was back when the DNA test was only 94% accurate. Today, with my technology, you can be 100% sure. My name is Nik Pootakham, and today we're talking paternity tests. Not for us, not for Steve Jobs, for hybrid fruit and vegetable seeds. Seed company always want to make sure that they provide you the seeds that come from the correct parents, because when they're not, they look like those. And this is very bad for their reputation. It's bad for the economy. $50 million go to waste every year from food like that. So they try to make sure by doing a seed purity test, they basically just grow them out in the field, wait the entire growing season, and look at the plant to see if they look like what they're supposed to look like. None of the company likes to do it that way because it's not accurate. It takes forever and it's very laborious. So two big companies came to us and asked if we could help. So we developed what's called Hybrid Shore. It's a DNA-based technology that could do seed purity testing just like that. 2 days instead of 6 months, very accurate, and it works on any variety. We're not just helping the big corporate company make money. We also help farmers. They will make more money, they can send their kids to school, take better care of their family. The market size for hybrid seeds for Thailand is 210 million USD. And the two companies that came to us, they occupy almost a quarter of the market share in Thailand, and they will be our first customer. So our technology is ready. We have 7 patents filed. We are ready for market. We have a great team of scientists, me included. I am the CTO. And so we're looking for an interim CEO who will be rewarded 10% equity on a success basis. Our valuation is roughly 600 to 700,000 USD, and we expect our CEO to raise the valuation to roughly, actually to a minimum of $5 million in 5 years for a trade sale. So if you're just looking to make money, you could do it anywhere. But if you want to make an impact, a significant impact to the seed industry, if you want to help make the world a better place, providing fruits and vegetables that have high quality, come join us, because Hybrid Shore, it's not just a paternity test. It's a revolution. Thank you very much.
Nick, well done. Well done. Okay, judges, please.
Well, you're starting with Steve Jobs. The biography of Steve Jobs is absolutely fascinating, actually, what's gone on. Can I ask, I didn't quite understand what the test was that you do. You sort of went over that rather quickly. Are you actually testing a sample of seeds, or would all seeds be tested?
The typical way of this being done is for a batch of seed that the company buy in from a farmer, they will test a certain percentage of the seed. So they will sample the seed and then we test those samples. For the grow out test, they usually test around 100 seed, which is very little in my opinion, but that's how much they can afford to do with the time and money they have. But with us, I think they can do 1,000, 10,000. It will take practically the same amount of time and it won't cost a lot more.
I mean, I don't know how many seed companies there are in the world, but there must be quite a few.
A lot, yes.
Yeah, and certainly, I mean, I grow my own vegetables, so I have a vested interest in this. But what would be the capital cost of a piece of equipment for a company testing seeds?
Very high. but we are not buying them. We're going to rent them. Unfortunately, the institute that I work for, NASDA, will purchase a very state-of-the-art, ultra-high throughput SNP genotyping platform.
Right.
And when we spin out the company, we will rent the equipment based on the time used. And so we don't have to buy the capital, but that is very expensive. Yeah, you're right. Yeah.
Okay.
Can you explain which bit of the process do you actually do? I understand the DNA part, but how much of it do you do, and then how much of it does your customer do? Which bit and what skill sets do you need to do what you're planning to do?
Right, so the customer, if they're based in Thailand, they will send us a batch of seeds that they would like to test, and then we will, if it's a big seed like corn, we can extract DNA directly from those. But if it's a tiny seed like cucumber or chili, we have to grow them. So we have a growing platform, an automated growing platform that would germinate them into tiny, like a little bean sprouts, and then you take that into a tube, do a high throughput DNA extraction, do a reaction that would test for the DNA, and then give them the results back.
So you've just mentioned you've got a service model, and your customers are seed companies. You've mentioned earlier that it will benefit lots of farmers. Do you think the farmers themselves will have an opportunity, and will they be able to afford to use your testing just to ensure they've got good quality seeds?
If they would like to, they could, but it's not often in their interest. So let's go back to this. So it's often in the interest of the company, because it's their reputation at stake, to make sure that it's the correct one. And in fact, the farmers will not get paid until they finish the grow out test. And normally, they double their production, their money this way, because if you can test it quickly, they get paid quickly. They can invest that into the next growing season. So I would say it's very unlikely that they would want to spend money testing it. And if it comes out bad, it's actually against them. The company is going to test it anyway. Yeah.
Sorry, is the expectation then that if you sell your product to the seed growers, will the seed growers be able to provide a warranty or something, some form of assurance to the farmers of the yield that they should expect, rather than currently you just buy some seeds and you hope it grows the way you want it to?
So we'll not be selling any products, so it will be more of a service. So they will send that seed to us, and then we'll perform a service, and we can issue some sort of certificate saying that it has to be certain percentage over for the seed to be bought in by a company. Does that answer your question?
Yes.
Oh, okay.
Okay, thanks very much.
Oh, okay.
Okay, thank you very much, Nick. Thank you. Right, so next up we have Juthamas. After Juthamas, we have Panomsak. Okay, so judges are just about ready. Pete's ready. He knows the drill by now. Okay, so Juthamas, after when you're ready.
Good morning. I'm Juthamas from Connection. Do you or anyone in your family have to live with eye drop in every day of your life? Now they have easier solution. We offer Silk Lens, our visions for your eyes. Today, 1 billion people suffer from dry eye syndrome. This includes people who use smart device many hours a day, aged people, and contact lens users. And the only one solution for them is using eye drop every hour, and they have to carry eye drop with them everywhere. We now have Silk Lens, the contact lens that keep your eyes always moist. Silk Lens is convenient, effective, and safe. There is a large business opportunity for Silk Lens. As you know, the global population of aged people, smart device users, and contact lens users are increasing every year. And many percentage of those billion people have got dry eye syndrome. And we look at the global market size of eyewear, it will be more than 127 billion pounds by 2022. And the global market size for artificial tear will reach 1.5 billion pounds by 2024. We are the team having 3 professors, including me, with the experience almost 20 years. And we have 4 researchers working together. Our milestone this year, we will raise the fund for pilot production and clinical trial. And next step, we will register FDA and scale up the production. In 2021, we will launch the product to domestic market and expand the market. Today, we are looking for the first round funding grant to do the clinical trial, 85,000 pounds for the clinical trial of silk lens. And if we get positive result, we will raise the second round fund to put silk lens into the market. We believe that your 85,000 pounds today will help a number of people to work happily and have a million extra working days with happy eyes. Thank you very much.
Well done. Another perfect timing. Okay, judges.
Thank you.
Okay, these lenses, do you take them in and out overnight, or are they reusable, or do you throw them away? What happens?
You can use it over the night. You don't need to take it out because it's made of the material that's very compatible to your eye. Don't make your eye irritate. So you can use it, wear it several days, yeah, and it controlly release some molecule to moisturizing your eye.
Okay,
yeah.
So obviously you're looking at, the silk is impregnated presumably with something, or is it just there as silk? Are there any chemicals on the
not the chemical, or the natural product, the natural molecule, yeah, the moisturizing molecule, yeah, not only the silk. Yeah.
Okay. How do you ensure that you're not getting infection onto the lens? Because that's one of the problems. You have to clean. I don't wear contact lenses, but my wife used to, and there was always cleaning them, and then there was irritation and other things. How do you ensure that they're sterile? Yeah,
that's very big problem. We have lots of tests in the animal, in the rabbit eyes, and we confirm it's very safe. Yeah, not promote any irritation in the rabbit eyes. But in the next step, we have to do clinical trial to test it very compatible and its efficacy in the human. And so in that case, we need to produce in the standard production, the pilot one that is a clean room, yeah, to make it very sterile. Yeah. And
last question: is it a porous structure, or is it a dense structure?
It's a dense. It's a film. Okay. Yeah, the soft film. Yes.
So just to carry on that point, so they physically stay in your eye continuously, weeks, months, years?
Yeah, you can. Yeah, continuous.
Okay.
Rare.
Okay. So how much would it be? How much would that product be for someone who wants? They just buy one, and that would cover the period?
It can stay several days, up to weeks, based on our research in the animal eyes. Yeah. And it's consumable product, of course. So they have to buy the new one within several days. Okay,
so how much would you envisage that it would cost someone for, say, a year's supply or a period of supply?
We only calculate based on the research. We didn't get into the market yet. But the cost would be very sensible than using the eye drop every day. Yeah.
Okay, so you would recognise that the eye drops were your competitor.
Yes,
and it had to be cheaper than that.
Yes.
Okay, thank you.
It's more convenient.
So I'm aware, I don't wear contact lenses, but I'm aware that it's uncomfortable, but it's something you get used to eventually. Have you spoken to some of your potential customers to understand the ones that do not wear, currently do not wear contact lenses, whether they would actually go for that kind of solution? Because eye drop just seems, you just put an eye drop in and that's it. Yeah. Whilst you've got something in your eye permanently. Yeah.
We also thinking about that issue. We are thinking about some service or some special instrument, especially for the aged people who are not so familiar with the contact lens. If we have some instruction or special instrument to get them wear easier or some service. Yeah. That we are also thinking, yeah.
You've mentioned artificial tear, so so are there other technologies that are similar in other parts of the world?
Based on our survey, yeah, it's not the thing that similar.
Similar technologies to other competitors.
There are some contact lens that incorporate the drug, but we are not the drug, but it's just the moisturizing molecule.
Okay.
So, yeah.
Okay, judges, that's enough. Thank you. Juthamas, thank you very much. Well done. That's brilliant. Right. Next up, we have Panomsak, and after Panomsak, we have Aluck. Okay. Aluck, please get yourself all mic'd up. Panomsak, you ready?
Yep.
You got the pink cross?
Okay.
Judges are ready. Pete's ready. Okay, we're having too much fun. Panomsak, in your own time.
Do you know that there is 10% chance for everyone of us in this room to become permanently blind at our age of over 60? And it could happen faster if you have a diabetes. Hello, everyone. My name is Panomsak, and I'm working on a technology that could prevent this to happen to you and your loved one. So the global issue right now is the aging society, and the vision loss will become one big problem for the society, especially if you are living in the developing country where the 70% of the old people live in the rural area. So the only technology that can allow the doctor to see different layers of retina and allow for the early detection and save you from the blindness is the OCT. I'm working on developing a low-cost OCT system that can be more affordable for the primary care in the developing country. And the device is going to be fast and is more accurate than the other two that are available for the doctor in those areas. So the market of the OCT retina scan is growing with the 6% growth rate, and the biggest share will be in US and European, with the key players like Carl Zeiss, Popcorn, and Heidelberg. So I'm looking after the market in the developing country where the cost of equipment slow down the growth. We are now at the TRL 5, and I'm looking for the 500K to move to the clinical ready product within 2 years, so to make development faster. So the cash need to reach the final market will be 1.5 million eventually, and I estimate the turnover in 2027 to be 4 million with the profit of 400K. So I understand that the market size is not profit enough for the VC investor, so I need to approach the charitable foundation and government subsidies to move forward. So to summarize my ask, I need initial fund of 500K to move to the clinical ready and pursue the clinical trial, and I need some interaction to the charitable foundation. And finally, I need a business mentor and partner to join me in this journey. Thank you very much.
Well done. Well done. Okay, so judges.
Thank you. I wanted to ask about, I know you've mentioned that your device is cheaper than the existing technologies. So have you considered the price, and have you talked to potential customers whether it would still be affordable to local hospitals in Thailand?
Yes, we did some tech show over the years in Thailand. Every year we go to the technology showcase, and we encounter with the potential customer, mostly the doctor. And the problem is that they don't even have this kind of technology in Thailand. There are not more than 20 machines, and they are in Bangkok. So there's a lot of doctors that work in the rural area, and they see this potential and they want to use it, but the price is too high and the maintenance cost is just too high because it's the import products. So they're actually interested that if we can bring the cost down to the level that their hospital can afford it. So they want to use it, and they said they can save a lot of people, because the retina is one thing that you cannot replace it. For this moment, there's no artificial retina. Once you lost it, you lost it. You cannot recover the lost retina. You can just save the rest of the retina. So once it's gone, 100% you just permanently buy. That's it. So that's caused a lot of burden, even for the government. I think it will create a big benefit for them.
One of the problems with technical equipment is what to do when it goes wrong. As part of your offering, did you envisage offering maintenance as well as the product that does the actual test? Yes,
that also part of the revenues that we are looking for, because all the medical equipment will definitely need maintenance at certain points, or even annual regular maintenance and service. So but in Thailand, we need to promise a free 1-year warranty. But after that, we can create a plan for the extended warranty or regular service, or even the time-to-time service with the court. So.
Yeah, I mean, I'm fairly familiar with all this. You can see.
Yeah, I can
but what I didn't understand, what's the major reason for the lower cost? Because you're still using a form of tomography, aren't you?
That's a good question. So the idea, after I talked with a lot of doctors who are using the device in Bangkok, and also some doctors that have been using it, the problem, actually the key players, the target market is in US and Europe. So the doctor actually do a lot of research. So they put a lot of features into that machine. But what I'm going to do, I'm going to remove all the unnecessary features and leave it only the feature that you really need for the screening at the primary care.
Yes. Yeah.
So that's the idea. And also we will try to optimize the cost for the hardware, and also we will develop the in-house software to deliver with the product.
I mean, even looking at the supply of this equipment in the UK or America, the markup on the equipment is very, very high. So would you be able to reduce the sort of profit part of it as well? Because certainly in Europe and America, there's normally a supplier that supplies everybody, everything, and can get very large profits.
I'm sorry, we're out of time. I'm sorry.
We can talk,
okay. Panomsak. Thank you. Well done. Okay, so next up we have Aluck. Please come and join us on the pink cross. And after Aluck, we have Punyawan. Yeah? Okay. Punyawan will get mic'd up. Our judges are ready. And Pete's ready. And Aluck, please, in your own time.
Ladies and gentlemen, allow me to introduce RadiClean, the next generation of surface sterilizer using hydroxyl radical technology. A little stats. Do you know that each year children miss 300 million school days due to sanitation-related illnesses? The number of healthcare-associated infections is overwhelming. 722,000 HAI incidences in the US in 2011. 10% of these patients didn't make it. As simple as food, 600 million cases of foodborne illnesses. 500,000 resulted in death. Sadly, 1/3 are children of the age under 5. So I've been in this business for some time, almost 2 decades. I have seen the practice of the food industry. They're foaming with harsh chemicals. They have applied more foaming on those corners, tight areas that hard to reach. Then rinse it off with massive water. And those same chemicals that kills microbes in the processing area we would upset their wastewater system, generate a lot of wastewater. Then they apply those traditional equipment, cleaning, and a lot of labors. This disinfecting fume can do the same job in minutes with a press of buttons. This is not ordinary fumes. It's packed with a lot of punches. It's filled with hydroxyl radicals. It can oxidize organic materials on its path. If there's a surplus, it will oxidize itself, turn to water and oxygen. So this is my third version of my prototype. I have 3 government funds. I have 1 successful industrial trial with a Play-Doh factory, and have 1 patent application filed. For the business model, I'm going to sell the equipment as one-off, or I can rent the equipment out and provide some cleaning services to promote the use of disinfectant liquid. First few years, food and pharmaceutical industry. Long shot, hospital, schools, medical tourism. I have such a brilliant team right now. The lady in the middle is my PhD student, and a veteran from have 20 years in business. I have almost 2 decades consulting food industry. My ask is $300K USD for more prototyping and more industrial trial, and also looking for strategic partners. Thank you.
Okay, well done, and look, right on time. Right on time. Okay, judges.
As I understand it, you have to take your equipment into your room where you have the, where the fumes circulate. What do you do about conveyor belts and other big pieces of equipment? Because you can't remove those in on a regular basis. And sanitation has to be done moment by moment. So there's you're going to have a lot of stuff waiting to go into your room. I mean, it strikes me it would be fine for small pieces of equipment you use irregularly, but for big pieces of equipment which you can't move, how would you apply it?
It can go in 2 ways. One is to install, we have going to have like S, M, and L size equipment, so it's covered the size of the room, or we can install engineering projects such that this thing is specially installed on those conveyor belts, on those spots that need to be cleaned.
Okay, so you encase the whole conveyor belt, and then you apply your...
No, like in the production practice, there will be some breaks. People go to the toilet or in the lunchtime. So if you do it like often enough, you don't need to be off a lot. So you just install this thing on where you need to get it clean, or you can just have the equipment move in during the breaks.
How does the cost of your product or process compare with the conventional ways of sanitation and surface cleaning?
If the overall cost is concerned, including humans and everything, this would be faster, using less human if you've done it right.
So you've just mentioned it could also be used in food industry, in hospitals, but again, I just want to continue kind of in a similar, on a similar subject in terms of, you're saying less people. So for example, in the hospitals that be using autoclave systems, so you would still need people you would need building, you would need a room, and you would need people to be moving the equipment into that room to have it cleaned.
Right. This is for like a processing area to produce food, but for the hospital, they would be applicable for like those toilets or some rooms that not for the tiny equipment that need to be out of here. That's just, it has to be done, it has to be done. But for like a toilet where you can spread germs, people acquire HAIs when they go to the toilet, or like some susceptible surfaces in the hospital, in the environment. That's right.
Okay. Judges, you done? Okay, thank you.
Thank you.
All right, so next up, Punyawan. After Punyawan, we have Katawut. Katawut, please get mic'd up. Please welcome Punyawan to the stage. Okay, so our judges are ready. Pete's ready. Punyawan's ready. In your own time.
All right. Good morning, everyone. My name is Punyawan Lumpaopong, and I am from Australia. At Atchara, we help people, and we are working on solution for infection following joint surgery. We all know that joint replacement has become very common for today's aging society, and the number is projected to over 7 million procedures per year in 2030. However, we all know that infections do occur and repeat surgery is required. We know that we can do it better. We have started our first project with knee replacement. We have developed MOVIT, which is a surgical instrument to help surgeons make temporary joint replacement like that with choices of antibiotics embedded in the materials at a very reasonable price comparing to our competitors. MOVIT can overcome all the features of other competitors and also the conventional method. With MOVIT, patients are allowed to move their knees while the infection is being treated. And also it can reduce the occurrence of complications after surgery. So patients, surgeons, and hospital benefit from that, and that has a strong commercial value. Atchara, we have more than 20 years of experience in business, surgery, and engineer. In 2018, we have received government funding to help us make the prototype and also run a product trial. We have done everything within 5 months, and we have received excellent satisfaction from surgeons and scrub nurses who are willing to participating and looking forward to participating into our clinical trial. We are asking for £200,000 for investment in order to do more product trials, clinical trials, and work on international patents in the next few years. So Atchara, we help people treat infection more effectively. We are raising money to make progress, and our exit strategy is likely to be via trade sale. We are Atchara, we help people. Thank you very much.
Well done. Fantastic. Okay, judges.
Thank you very much. Is it, so you mentioned you have a file patent.
Yes.
And in terms of the patent application, what are you protecting? Is it the way you incorporated the antibiotics, or is there something new about the material?
Not exactly about the material, but the way to form the shape, which is we have one of our products. The temporary joint replacement that we can develop, that we can make from the product is very close to the joint replacement. So nobody, our competitors, there are only 4 competitors in the market, and they only have a very simple shape. And also, especially we are working with the knee, the competitors, they don't have left and right knee, which is in fact, they are different. Yeah, so we made both left and right knee possible. Yeah.
So is it your intention to compete against your competitors or to join with them and collaborate?
I would like to compete with them because from our research, we have found a lot of limitations and downsides from their product, and they are really expensive. So it's very limited to the people in the low to upper income countries.
Is this a form of hydroxyapatite that you're using, which is impregnated?
We use PMMA.
Sorry, okay, so it's a polymer.
It's polymer.
A lot of knees now are done by robotic surgery because of the accuracy you need, and I understand it's plus or minus half a degree.
Yes.
Your sample that you showed us there didn't look terribly accurate, rather bumpy.
Yeah, it is because it's used only temporarily for 12 weeks.
Even so, there's an awful lot of pain. If it's misaligned, there's a huge amount of pain.
Uh-huh.
I mean, have you had any field trials that have got feedback from the patients?
Oh, that's the clinical trial that we are raising the money for. Yeah.
But could your joint be used with robotic surgery, or do you have to have a human intervention?
For robotic surgery, I think it involved a lot in the dissection and also the cutting of the bone with the jig, and for putting in the temporary knee replacement, it's a human work anyway.
Yeah, okay.
Yeah.
Okay, thank you.
All right.
Okay. Well done. Thank you.
Thank you.
We're good. So, next up is Katawut. After Katawut, we have Kitiya. Okay, everybody's ready? Everybody's here?
Yep.
Katawut's ready, the judges are ready, Pete's ready, fellows are ready.
Yep.
In your own time.
Hi, everyone. I'm Katiya, a researcher from National Nanotechnology Center, Thailand. I was born in the rural sides of Thailand, where I have the fish farms all along the rivers. I still remember when the summer comes, the water level is going down, the outbreak disease is coming. There are a tons of fish die along the river. The way that they solve the problem by dumping in a lot of antibiotics into the river, that contaminates our environment and also contaminate our food chain system. Why they don't use the vaccine? Because there's only one vaccine, injection vaccine, available in the market. And it's not suitable for the small fish, and also costs a lot of money. So I come up with the idea how we innovate the immersion vaccines. I developed the nano vaccines in the nano size particles. And as a result, you're seeing that our product can increase the survival rate of up to 80% for 2 months after vaccinations. And we filed the patent last year. And recently, we got just finished our first trial of a field test, and the result is very good. Our first customer is our they shares a half of the market in Thailand, not just only the market in Thailand. We have the market opportunities all around the world, especially in the country that have the tilapia production, such as in the China, in the South America, and also Africa. Additionally, the UK fishmonger companies also interested to our innovation to adapt into the salmon farm. This is our collaborations and potential customer. We work together really, really hard to push our innovations out to the market. And this is our team. We have really lovely veterinarians and really genius R&D scientists. But we're gonna looking for the business and financial teams come join with us. If you are the one, please join us and let's innovate aquaculture together. We still need 300K for our next levels of the field testing and market research. Thank you.
Well done. Perfect timing. Okay, judges.
Okay, obviously you showed fish farming on the rivers and things, I mean, which is becoming increasingly big, but people are very worried about what contamination. Now, is there any after effects when you've well, you don't actually vaccinate them really, do you? You sort of immerse them in this liquid. What are the implications for the for your rivers and other things of this technique?
Okay, that is good questions. The first thing, we immerse the vaccine when very small fish, finger fish, the size of the finger, and we put it in the barn. That is not caused like we not dump it in the liver.
No, I
the second thing, our vaccine is the Q vaccines. It's not active, and the material that we use is just lipid carrier that is not harm to the environment.
Okay, and it's applicable to all types of fish?
Right now, we testing the field test with the tilapia farm and also the sea bass farm. Yep, that's that. We're gonna be expand to the other fish as well.
So, is the expectation that you will be able to guarantee a supply of fish and their quality, and that they won't die, or that you sell more of them? What the value? Could you articulate the value?
Okay. Okay. The thing is, in Thailand, they don't vaccinate the fish because the cost is the double. For example, if the fish costs like 10 cents, if you vaccinate fish, it's like 20 cents. So that's why they just use, okay, we don't need it. It's because it's seasonal disease. Somehow it happens, somehow it's not. But when it happens, it costs a lot of money and of fish. So if I lowering the cost and everyone's just happy to pay for that, I think like we can save all the disease and save the farmer as well. I answered the question?
I think so. I mean, it sounds like the equivalent of a sheep dip system.
It is,
yeah. Okay, that's fine. Yes.
So have you done the economic analysis and just to understand whether is it just applicable to large consumers or is it smaller fish farms as well in terms of if they are to lose, let's say, once in a while, would it still be worthwhile for them to invest into your solution?
I think that right now they have like just only two companies that sell I call it hatchling fish. So we start with them first because like they are kind of like early adopter. If the market is kind of like educated, many people know how to vaccinate. It's really easy. Just dump the fish in the tanks and it's gone. I think like all of like collaborative fish or the small farming, they can do it by themselves. I think like our product maybe reach into that market as well.
Okay. Right. Thank you very much, Katawut. So, next up we have Kitiya. Kitiya, please come and stand on the pink cross. Okay? Yep. After Kitiya, we have Waranyoo. After Waranyoo, we have coffee. That'll be a great pitch. Right, so Pete's ready, judges are ready. Kitiya, in your own time.
Good morning, everyone. My name is Kitiya from Prince of Songkhla University. Imagine if you went out last night, ate chicken contaminated with salmonella, got really sick. What would happen today? I would be here standing, talking to myself, and have no judges, have no audience. So I'm here to introduce you the solution for fighting against salmonella in chicken. If the poultry meat products are contaminated with salmonella, companies have to do recall of the products, which can cost company millions of dollars. We offer you SalmoGuard, a bio-disinfectant, which is highly effective against a variety of salmonella types. It's been approved by the US FDA. Compared to chemicals and antibiotics that most farmers in Thailand are currently using, our product is better to save your company from having product recalls, keep your company reputation. Farmers can expand their product to premium section and then can move forward to organic farming with no additional cost. Our product is safe for consumers, farmers, and the environment. Now we have the prototype ready. We have one patent filed, and we have been approached by the two large corporates who are big players in the poultry industry in Thailand. So now we are ready to move up to pilot production. Looking at the total number of chicken farms in Thailand, the majority of these farms belong to these two large corporates. So we aim to capture the markets or the farms under these large two corporates. Into 2020, we aim to plant our product to the two farms with the revenue of 4 million, and we move up to 18 farms within 5 years with the revenue of 20 million. We have a great team. We have veterinarian, medical microbiologist, and myself as a food safety expert. Advisory board members, a professor, and a former R&D director who has 40 years of experiences in food and feed industry. We're looking for partnership. We're looking for funding of $750,000 to move forward to pilot production, regulatory approval, and marketing. We look for potential pilot customers, management team. Ensure food is safe, go premium, go green with SalmoGuard. Thank you.
Well done. Well done. Okay, judges.
Thank you very much. At the beginning of the presentation, you've mentioned that you already have some regulatory approval, but you're also looking for some money to get additional regulatory approval. Could you please tell us more?
Yes, this technology is a phage-based technology. It's been approved by the US FDA. So now, in order to use in my own country and other trade partners' countries, yes, we have to do regulatory approval in that specific country, yes.
So is it already in use on any farms in the US?
It's already used in some of the farms in the US, yes.
So how exactly would it work? How would you apply your product?
Yes, so my product, it can be in a solution. It can be added to the drinking water for chickens. So now the farmers can just use my products in the drinking water, and then it will go inside the chickens and kill salmonella inside the intestines of the chickens.
Okay, so what would be the cost per chicken?
Yes, I have that number on hand. So yes, the cost for treating the chicken is very cheap in Thailand. It's only...
Yeah, I'm really more concerned about what it would cost here.
Oh, yeah, that's unfortunate. I mean, like, for production side and like for our products, it's you can make your product up to premium, like, but using with the same price that we are selling to you. Yeah.
You probably know that there's a big discussion in this country about importing chickens from America because they're chlorinated.
Oh.
What sort of guarantees would you give to the public here that it was not going to affect them?
So actually, my product is biocontrol agent, so it's natural. It's you know how we have viruses that attack us? This is kind of a virus that attacks salmonella in chicken. So it's safe for just attacking salmonella in chicken, but then it's safe for like consumers. Unlike antibiotics and chemicals that you have some residuals left. So it's not even considered chemical treatments. It's biocontrol treatments.
Okay, thank you.
Yeah.
Okay, judges, we're done. Thank you. Well done. Kitiya. Well, fellows, please give it up for our final pitcher from Thailand. Right. So, judges are ready. Pete's ready. Waranoo's ready. In your own time.
Thailand is like other developing countries that could not develop drug by ourselves. Last 15 years, I got supported by Thai government to do PhD in US, and I work in this company that developed Ebola drug using tobacco plant. 5 years ago, when there is Ebola outbreak, this company sent the drug for US citizens who get infected and sent back to US, and they can save 80% of their life. I have a question for myself. What if this happened in Thailand? I have experience in this technology for more than 15 years. I with my colleagues, Dr. Suthila, who is the expert in pharmacoeconomics and Thai FDA consultant, started the company to develop the platform using plant to produce like proteins. We can produce very fast and the low production cost and no contamination of human or animal pathogen. If we need more protein, it's very easy to scale up. We just grow more plant. Right now, this is the only technology that can combat rapidly with the emerging disease in the world. There are a few facilities in US and Germany, but no in Asia, where there are more than 4 billion people and lots of emerging diseases. This is really need for the region. Actually, in the normal situation, there are several applications that the product from this technology can go for. Looks to rabies is a big problem in Asia, and that the market is more than 1 billion. Only in Thailand, we import more than 25 million every year for rabies drug. We still have the opportunity for cancer drug market, pet pharmaceuticals, and also for cosmetic industry. The first product that we will launch to the market is growth factor from plant that can effectively induce skin cells to produce more collagen. In Thailand and many countries still ban growth factor from human cells. Then there's the niche market for our product. The next is anti-cancer for dogs and cats. In the future, there are going to be people who have no kids and want to have pets. Then there still be the market for our target. We're going to aim for the human drugs like rabies, cancers, but it takes 10 years. And if we have this platform available, it can be used for other emerging diseases as well. Our business model is a service for protein production for expensive protein that is difficult to express in other systems. And we have the customer in pharmaceutical industry, cosmetic industry, or for the early adoptive in research field. Right now, we get $50K for cosmetic application, and we get $50K for cancer project, and also in the process of dealing with $3 million for clinical trial phase 1 for rabies. We are asking for the strategic partner for cosmetic. We need the executive from pharmaceutical industry who is interested in our technology and want to work with us. And we also need the support like LIF program, but more specific for pharmaceutical industry. Bayer Phytopharm, we are not the only biopharmaceutical company, but we are planting for the world's health security. Thank you.
Waranyoo, well done. Just in time. Okay, judges.
Okay, I mean, a lot of pharmaceutical companies are using plant-based materials. What is actually unique about your approach?
Actually, not. I don't think the biopharmaceutical company use. This is the company that produce protein drugs like biologics, which mostly they use mammalian cells. And like for mammalian cells, we need like really expensive media. But for us, it's different. We use plant that is non-GMO plant that growing in soil. And actually, in this world now, there are like 3-4 companies that use this technology to produce biopharmaceuticals.
Yeah, I mean okay, you seem to have an obsession in Thailand with wrinkles and things, but the real application is obviously in treatment of these diseases. But the cost of actually testing for those is huge, because at the highest security level, when I was at Imperial College, we had one of these testing. I mean, it was easier to get in the Bank of England than it was to get into.
Yeah, actually, I really understand that. And like one thing that makes it like difficult from what I see, because I'm working in Faculty of Pharmaceutical Science, and in our country we cannot develop any drugs. We don't even have like Thai FDA don't have IND for the new. Then the problem that like people in our country have is when we develop some like new biopharmaceutical for the new disease, the disease that is in our country, like let's say for rabies, I get the funding to do research here. We try to get funding from EU, from UK for rabies drug, but no one gives us because we don't have rabies here. Then Thai government really need to support the country to develop the drug for our countries. Then actually, like for this technology, it can decrease the cost of like GMP batch for monoclonal antibody like half, more than half, comparing to mammalian cell system. Then that's why I think right now the government very like interested in this technology and want to support for like rabies is the first one, but we're gonna go for like cancer antibody and also other diseases like dengue. Yeah.
Okay, I was going to continue the question that's just been asked, I suppose, but I think you've sort of answered it. Is that the novelty of your product is that you're able to apply your technology to diseases that are local to Thailand, whereas the other competitors wouldn't be interested in them.
And other diseases in other developing countries as well, but that's right.
Yeah, okay,
right,
fine, okay, I see. And in that case then, do you have an idea of the cost model or how cheap your product needs to be for it to actually be viable or attractive?
Actually, I don't want to beat for the low-cost production, because actually, I have to say that for the downstream process, it's quite the same, but our platform has the advantage about like the rapid. Then it's very fast for production. Then that's why I really need to have this platform for the safety of the country. But we are looking for some like other proteins that is need for the market. Like let's say for all the contact lens, the cosmetic that need like molecules that activate the cell, those are all expensive. And in Thailand, we have to import all of those molecules from other countries. If we have this, then they are all of my customers. Then I will aim for some other molecules for the market. Yeah.
So obviously the reason the pharmaceutical industry uses mammalian cultures is the correct protein folding. So how do you ensure the protein folding in plants?
Thank you for the very good questions. Like, plant is one of the eukaryote organism, and there is a post-translational modification, from the studies. When we produce the protein from plant, the folding of the protein is quite similar to human cells, mammalian cells. Then that's the advantages of using plant.
Judges, thank you very much. Waranyoo, thank you. Thailand, it's a wrap. Well done, congratulations. Vietnam, you ready? Okay, right. So here's what's going to happen next. Before we move on, we're going to have a coffee break. Okay, just outside? Okay, and are we just outside or downstairs? Just outside, okay. Can I first thank Pete for perfect timekeeping, Steve for perfect slide prep, and the hard work from our judges just now. Thank you so much, guys. It's hard work. Okay, when we come back, we're going to move countries, okay? So what I would like to see is Vietnam over there and Thailand over here. It'll make moving around quicker. Thank you very much. Let's have coffee. Back at 11:30 to start promptly. So first up, we have Thu. And after Thu, we have Lu. Lu. Am I doing all right? This is the difficult group. So Lu, if you could make sure that you're mic'd up and ready. Okay. Thu, please welcome Thu, the first of the Vietnamese pitchers. Your clicker. Okay, so judges are ready. Thu's ready. Steve's ready. And Pete's ready. Thu, go ahead.
So, good morning, ladies and gentlemen. My name is Thu, and today I will talk about the early diagnosis of pregnancy for cows. So, the Vietnamese demand for dairy products and beef products is increasing. We are agriculture country. However, we have to import 75% of the dairy products. And one of the reason is low cattle reproduction. And for example, 40% of the insemination is failed. And the detection of the pregnancy is very, very late. So the conventional method is rectal examination by using the hand at 60 days. And our stick solution is at 22 days. Oh. Okay. So comparison to for two methods, the conventional method takes 10 minutes, and it has required screen vet, and also has high risk to cause the damage of the rectal. And for the stick solution, we only need 1 minute and no required for vet, and simple and quick, and every farmer can easily do it in their farm. And comparing the stick supplier, so the competitor have to import it. So the competitor are imported, so they have to pay huge money for import tax. So our so we are cheaper local supplier, and by those things, lower price and support from government. So we expect to increase the business value greatly in the next few years. Until now, we received 2 great grants from university and also from government to develop these products. And our current state is a pre-product prototype. And we also have a strong team with 3 people, including me. And we're looking for additional staff. And the plan for the next step in 6 months, we will develop the final products with the partner, and we will trial with about 20,000 sticks in the end of this year, and we start to commercialize the product in next year. To do that, we want to raise the fund around 80 to 100,000 US dollar. So I really hope that we can bring this product to the market and to help the farmer to increase their animal productivities to supply enough the dairy and beef product to Vietnamese market. Thank you very much.
Well done. Well done, Thu. Well done.
Thank you.
Okay, get back on that spot. Right, judges.
Okay, that's very interesting. Can I ask, you said about a key partner for stick production. Is that a company in Thailand, or is that a company, an international company?
Yes, our key partner is the company to attack the protein to the stick. It's a company in Vietnam, and they produce in Vietnam. Yes, we are Vietnam.
That's my mistake.
Yes, it's a Vietnamese company.
Yeah, so if I understand you correctly, the technology already exists and your competitors have it.
Yes.
But it's just expensive to bring into the country.
Exactly.
Is there anything else specifically about how it's being produced or the technology that's actually within the sticks that makes your innovation novel?
Actually, the technology is already existed in another country, but in Vietnam, we are the first one to produce these products. Yes.
Thank you.
Yeah.
So what would stop another company or another university developing very similar solution in Vietnam?
In the world or in Vietnam? No, we are the one.
At the moment, but what would stop somebody else doing it as well?
Yes, some university, some agricultural university are looking for do that, but it's not easy. The technology is not easy. Yes. Yeah.
So would your technology still make sense if the tax benefit were withdrawn?
The technology?
Would your innovation still be financially viable if the tax?
Yes.
Okay.
Yeah.
Okay. Right. Thu, thank you very much. Well done. Right, that's the first pitch over with from Vietnam. Now, volume up. Okay. I think that comment of volume up doesn't apply to me. Yeah, it might apply to you guys, okay? So please speak up and make sure that we hear about the wonderful innovation. Please welcome Lou. Okay, now after Lou.
Yes.
Got it. Lou. We have Long. Yeah? Good. Okay, so Long will get mic'd up. Lou, go ahead.
Okay. Hi, ladies and gentlemen. My name is Thi Luong, and now I am a CEO of Scitech Joint Stock Company in Vietnam. And before I talk about my innovation, I have one question for you. Are there anyone here having a problem with stomach disease? Well, my father died because of this disease. I'm not supposed to want to talk about the pain, but it's a big fact in my country right now. 70% of Vietnamese people are at risk of stomach disease, and 26% of Vietnamese people have a real symptom of gastric. It's a big problem in my country right now. And there are two normal ways for treatment. The first one is to take antibiotic, but you know that the rate of antibiotic resistance is so high right now. And another way is to take herbal medicine. But you know that it's not convenient for our country, people in my country to use. So that's the reason we come up with the idea of anti-HB, a health supplement for people with stomach disease. And we try to put more efforts on to do research to find the active components in this plant. And the key thing here is that we figure out the formula to combine those components to maximize its effects on the stomach disease. So we use B2B channel to deliver our product to drugstore, and we found that in our markets there are 57,000 drugstores in our market, and our target is 5% of this, with the value is $10.4 million US. And our business channel is to try to build a new brand for herbal remedies and sale and distribution. And another business model is for build the supply chain for raw materials too. So that can help us to make more the social economics distribution benefits for our society. And unlike the other existing product in the market, the key things that makes our products more different is that it can cover the major symptoms of stomach disease at the same time. And here is our development plan. In the 2018, we tried to establish our company with 3 co-founders, apply for patent and some safety regulation, and get more feedback from 200 early adopters. And over the next 18 months, we try to focus on 2 things. The first one is sales and marketing, and the second thing is try to build the raw materials area. And our team have a different discipline, but just the research, sales and marketing and finance. And that's the reason why we're so confident to be here to call for $300,000 US for Danao's business to build and grow herbal material supply chain and sales and marketing. And thank you so much for your listening.
Well done. Well done, Okay, judges.
Okay, you're saying you're applying for a patent.
Yes.
What are the key claims of your patent?
Well, exactly. We have applied for this one, and it means who is owner or who is inventor?
what I don't understand is what it is you're patenting.
Yeah, we apply for this patent for the process to produce this kind of product from those plants. And right now we have technology to find out the formula to compile this component to maximize its effects. Yeah, and so different from the other existing product on the market. Yes. Yes.
So you mentioned the competitors. Could you give a little bit more detail as to why it is that someone would want your product as opposed to the competitors?
You mean some difference from the competitor?
What makes your product better?
Yeah. Oh, well, exactly, as I said, exactly in our markets right now, actually have 20 competitors providing this brand. But their products just cover 1 or 2 symptoms of stomach disease. And we have a research and find the formula to maximize the effects of components, active component in this brand, so can cover at least 3 symptoms of stomach disease, so that can make our product different from them. Yeah.
Thank you. So you've mentioned that you're using a local plant. Is that the plant that grows in the wild? And if it is, do you know whether you can actually grow it to ensure supply on a larger scale?
So I understand your question. In our product, there are 3 main plants. 2 of them is the local plant and can be very easy to be grown. And 1 is grown in the forest. So it means that right now to take this one, we are inspiring them from the people around our local region. And our ambition, as well as our mission, is try to be a new brand for remedies, reputation for our local brand. So we try to run to build the supply chain for this one. We want to control the output for producing this. So that can make more the contribution for social and economic benefits. Yes.
Okay.
Yeah.
Thank you very much. Right, next on to the pink cross is Long. Please welcome Long.
Thank you.
Okay. Now after Long, we have Ha. Ha is ready, getting mic'd up. Long, your slides are up. Pete's ready. Judges are ready. In your own time.
Good morning, ladies and gentlemen. My name is Long. I'm the founder and CEO of CCS Vietnam. So my organization focuses on helping poor people to access clean energy. So you know that there are 3 billion people still rely on cooking by the solid fuel, direct combustion, and you see how smoky and how dangerous it is. It kills 3 million people every year. So by the end of my pitch, there will be 18 people, mostly women and girls, die because of this problem. So we propose to still use the existing fuel, but in a better way. Gasify it, make the gas out of that, burn it in highly efficient, clean, and safe way, as a flame you can see on the screen, and at the same time, produce biochar from that process. Every family moved to this way can save and bury to the soil as a fertilizer 600 kilograms of CO2 every year. So our commercial product that we would like to propose is this. So this is first of the kind that can work continuously as a household cookstove. It has a world record of thermal efficiency. And for the basic product, the production cost is just £7. So this is our wonderful team, small but dedicated. We worked for 8 years on this solution. We already have the international and national prizes. And we have IP protection in Vietnam and also in Denmark. So for maximizing the social impact, we don't want to sell and produce directly the product. We want to bring it through the government, through the carbon reduction organization or traders, and through the development organization by helping to set up the product service system in the location. And by that way, helping them to produce the good product using our label, using our technology, using our training, our design, our technology. So by that way, we can get the money back from the technology transfer, from labeling, and also from the carbon certificate reduction cell. So we can get about 1,400,000 pounds after 3 years, and we are here asking for 530,000 pounds in that period. So please join us in this wonderful journey to contribute, saving millions of lives and also saving our planet. Thank you very much.
And well done, well done. Just on time. Okay, great, judges.
Thank you for your presentation. Just wanted to ask, what is the actual technology? I didn't quite understand.
Yeah, that's biomass gasification. I intentionally did not put that into the slide because it's too complicated. The way to make it is like this. We create the optimal condition for gasification by having the very high temperature and at the same time insufficient oxygen supply. So in theory, 23% of the oxygen that need to burn completely, it's good. So that's the way.
Okay, so it's actual stoves you're making?
Yeah, generally it's a solution. It's a technology. The stove, it's just embodiment.
Okay, I mean, there's quite a lot of small-scale gasification stoves that are on the market at the moment for camping uses and the like. In what way is yours different or better or more appropriate for the local market?
Right. We are a member of Alliance Cookstove, Clean Cookstove. There are 3,000 people in that alliance. We are just one member. So what make us different from them? After 8 years of working on that, we find out that, okay, people try to make a simple one, large one, because they work in batch. But we try to make very small, working, because in batch, you have to put enough to cook like at least 1 hour. For us, it's very small, and it can consume only in 5 minutes, but continuously fitting in. So by that way, we can make it very compact and, compact and create the best condition for that. But without losing too much money because we do not have to use too much material. So that is a problem. Gasification, biomass gasification is already 19th century technology, but used for the continuous and big, huge, multi-million-dollar factory. But when you make it into the size of 7 pound equipment, it's hugely difficult. But there are some secrets that we go for IP. We are not telling you right now.
Okay, but as I understand it, though, you can't just use any old piece of wood. You have to have a special supply of chips or something like that. That's going to be expensive, isn't it, compared with just getting bits of wood?
This is the cheapest way ever because it can use almost any kind of material with very small pre-preparation. So the only thing you need is to chop it, and normally biomass gasification require at least 24% of humidity or less, but we can go for 40%. Yeah, I won't tell you the reason why, but this is the way we can do that. And compared to coal, it's half the price. Compared to LPG or diesel oil, it's 20% of the cost. So it's the cheapest ever. So if you would like to know more, I'm very happy to talk to you later.
On that, though, you've got to have a supply chain. I mean, not everybody will have something for chopping up wood.
Exactly. You know, in our country, I already mentioned before, we want to set up the product service system. We have to rely on what people already have in the local location. So there are the industry called wood chopping or wood chip to make sort of pulp and paper. We just rely on that technology. Now, in each village, we have 2 or 3 factories like that. So we just rely on what they have.
That's it. We're done. You don't have to answer them anymore. Thank you. Well done. Okay. Next up, please welcome Ha. And if I could ask Nia to, he's all ready. They're very well trained. Right. So, Ha, you're ready, right?
Yeah.
Slides are ready. Our judges are ready. Pete's ready. Ha, please go ahead.
Okay, thank you. Good morning, everybody. My name is Ha. I'm a researcher. I'm from Vietnam Academy of Science and Technology. As you know, that now environmental pollution and climate changing. So now crop and salt rot is increasing. Now in Vietnam, it's a big problem in Vietnam. Every year we have a few million people who suffer from cough and sore throat. To treatment of cough, when you take the antibiotic, you will have many side effects. So now people prefer to take the product from nature to limit the side effect. In the markets now in Vietnam, we just have a few products from nature to cough. So it's a reason for us to develop the natural cough medicine. For working for a long time, about the 5 years, we found that this plant have a very, very strong activity, including 4 activities: anti-inflammatory, reduce cough, reduce pain, and reduce phlegm. So we do extraction and we do the formulation for the final product. Continue, we do the clinical trial for about 300 people suffer from cough and sore throat, and 75% of these people become to stop cough very quickly, and they don't need to use the antibiotic and no side effect. For the price, our product is cheaper, about 25% than the other. For my research, I have a IP for the extraction and extraction of active compound from this plant, and we have an experienced team research, and we have a final product. So now I'm a beginner for business, so I learned the business model canvas here, and I know my customer is the people with cough and low, middle, and average income people. We will take the revenue from the sale product for the pharmacy. In the future, I think I will need investment for the marketing research and master production. For the next 12 months, I will need some business partner or sale partner to help me to commercialization of my product. Thank you for listening.
Well done. Well done, Han.
Thank you very much. You showed a plant, which I didn't recognize, but what is your intellectual property in that? You showed a slide too of intellectual property. Is that a patent or what is it?
This plant? Oh, sorry?
Yeah, you said that there's some intellectual property in this process. That, yes. What is it?
Yeah. It's the patient for the extraction new active compound with new high biological activity from this plant, and we have a patient in Vietnam. Yeah. Okay, so
just to clarify, so it's the way you extract the whatever it is, key ingredient. Yeah. I'm not meant to ask another question, but when I've been in China, I've had things like this, but they've been huge tablets. How big are these tablets?
Yeah, I take the solvent is ethanol or water to take the active compound, and we use some skin to isolate the compound. Yeah, thank you.
On what basis are you assured that your product works? How do you know your product works, I suppose?
Yeah, because now we have a final product, and we do the clinical trial for 300 people. That's a very first step to test on clinical trial. Yeah, and we know about the benefit of my product. Yeah.
So what is the actual effect? What is the mechanism? Is it replacing kind of cough syrup, or is it actually treating some sort of infection?
Yeah, now we just have a product in capsule for the people, but I think the liquid is very important. So I am developed for the liquid, so it can use for children. It's better. Yeah.
So it actually stops the coughing.
Yeah, it's stop cough and short throat. Yeah.
Okay. Thank you very much, Ha. Next up, Nia. Please welcome Nia. So after Nia, we have Trung. Chung's getting ready to be mic'd up. Okay, so we have your slides, we have our timer, we have our judges, in your own time.
Hi everyone, my name is Nguyen Chinh-Nghia from Hanoi University of Science and Technology. First, I want to ask you a question. What kind of gasoline do you use for your own car every day? Normally now, you cannot use the normal gasoline. You must use the E5 or the E10. The biofuel is more friendly for environment. So I want to talk about today. Now, the Vietnamese bioethanol plants use conventional method for their production that cost a lot of energy and investment. And also they release a lot of waste into the environment and with very low value. So here, what we bring to them, first, an advanced technology to retrofit their conventional method by combining 3 production steps into just one. And this could help on average, bioethanol plants save about $500,000 per year. And also we offer a second technology to create more value from the waste by creating the high value feed product. And this could increase the revenue for about $700,000 per year. To summarize, if bioethanol plants apply our technology, they could save over about $1.2 million per year. And also this technology has some social impact by reducing the import of the animal feed products from abroad, and also reduce waste from to the environment. So, about the market in Vietnam, from 2018, the government forced people to use only the E5 gasoline. So, the markets grow about 5% per year in the next over 10 years. And now there's 15 bioethanol plants in Vietnam share market about $550 million. And this is very interesting for the investment. And what we do have, we have a very strong research team with over 15 years of research, and we are the only research team in Vietnam working on this technology. And we also have prototype, we have useful solution, a kind of patent in Vietnam, and we have back from the government. So in the short term, we'd like to apply our technology to the pilot scale. And in the medium term, we would like to license our technology to Vietnamese bioethanol plants. And after that, maybe an exportation to other countries in Southeast Asia. And what we ask here, we ask for let's user for about $300,000 to develop our technology for the first licensing. It is to scale up the technology from pilot to the industrial scale and to optimize this technology at industrial scale. Thank you for your attention.
Yeah, well done. Okay, judges.
So just, could you talk a little bit more about the waste product and how it's used for feed and how your technology improves that product as a potential feed?
Yeah. Actually, in Vietnam, this waste is wet waste. It's sold directly to the small farmer around the plant. And because it's wet, it's difficult to preserve it. And in our technology, we try to convert them to a dry waste with high value, high quality, high concentration of protein, of fiber. It's good for animal, and it could have it extends the preservation time, and it's better with higher price.
What aspects of your proposition are you actually selling? Are you selling equipment, or are you selling a license for someone else to build the equipment and use your technology? Which one, I suppose?
In fact, we expect to license our technology to bioethanol plants, meaning that we show them this technology. They need to just invest a bit money investment for installations, just a few machinery. And after that, they could save money from their production.
So does that mean that you are going to make the machinery and sell it to them?
No, we would not make the machinery. We only make the process. We optimize the production process. As the machinery, we will ask other partner to come in. Yeah.
My experience of processes like this is it's best to give the license straight away. And develop the technology on industrial plant.
Yeah.
You've got 4 plants, I think it said 4.
We wish for about 4 to 10 plants in the million terms.
So why aren't you going straight to them and saying, can we install the technology on your plant, rather than asking for 300,000?
Yeah.
Because it's always dangerous developing things in a laboratory and then taking it across.
Yeah, in fact, before we successfully licensed another technology for ethanol production to a smaller plant, and they save for about $80,000 per year thanks to our production. And this technology is based from the ancient technology, so we just improve it. And we also have a reference for our previous technology. And after that, why we ask only for $300,000? Because we need to also to access to the bioethanol plant in Vietnam, we need government back. So we need a government grant, a part of this, and the other part is from the plant. So after the first licensing, we could sell them more easier to other plant.
Okay. Yeah, thank you very much. Nia, hold on. Did you go to Stonehenge? Did I see a picture of Stonehenge? You know, these fellows went everywhere. At the weekend, Glasgow, Durham, Bath, Leeds, Paris, Oxford. You didn't come to Bicester, did you? Okay. Right, so next up we have Trung. Please welcome Trung. And after Trung, we have Ang, who's getting mic'd up now. So, Trung, you have something for us.
Yes.
Something for the judges. Okay. So, Pete's ready. Chung's ready. In your own time.
Hello, everyone. My name is Trung. I come from Vietnamese Traditional Medicine and Pharmacy Institute. Our institute is a private one, and we help people in the mountainous region to produce yacon. So, what is yacon? It's originally from South America. It's been there for thousands of years, and a very good use. And recently, be introduced in Vietnam for the last few years, and the root of yacon can be very beneficial to our health. We can eat raw, cook as food, and we can store it as powder or make syrup of it, and the leaf can be made as tea. So everyone here, we are all aware of the chronic disease and metabolism disease problems. So yacon root, with its nutritional and medicinal value, can help to prevent diabetes, to regulate blood pressure, high cholesterol level, and help to lose weight, improve digestion, and even prevent cancer. So last year we produced about 150 tons. It's a very small quantity, and we try to expand our business to target 2,000 suppliers in a hotel, restaurant, supermarket, and big more retailers, and which the market value is up about 1.5 million US dollars if we can provide about 1,000 tons per year. So we try to set up the supplier network and for new Yacon brand and fund more farming expansion to enable like product in the country and export. So I'm here today to look for raising investment of 350,000 US dollars so we can set up company through marketing, branding, and try to set up a B2B business and more logistic and retailers and applying technology for food processing. So we try to have an impact to raise awareness of the new Yacon product. They're good for health, improve social security and income for the people who involved in the project, and to have major impact on food market, nutrition markets, and we can provide information for scientists to have apply in life science, and most of all, we have good product for health to supply in domestic and international markets. Thank you.
Well done. Well done, Chung.
Yeah, so I have some here, so I can show you. This looks like a sweet potato, but in fact, inside it tastes like apple or peach. And yeah, so.
Don't start the questioning yet, Pete.
Yeah, I just.
Have you got enough for us all there, Chung?
Yeah, this is not a good piece because I brought here, like, it's 2 weeks already, so it's not that well.
This is bribery.
Yeah. So I want to help you to have a taste, a small taste.
I'm telling you, it's delicious. And it made me feel a lot better.
Sorry.
Thank you very much.
Make sure you get this.
I'm very clumsy. Sorry. Yeah.
See, you all look now 10 years younger.
Yeah, if you eat a lot of this, and it helps you to be younger, for sure.
Thank you very much.
Yeah.
Well, thank you very much. I'll eat it in a moment.
Well done, Chung. Well done.
Yeah, can I ask? Sorry, is this on? Can I ask what you bring to this? Because presumably this is available to anybody to grow it. Why? What is special about what you're doing?
Yeah, because I work in the field of healthcare and traditional medicine or natural medicine for the last 10 years, and I see the benefits of how you eat naturally or how you use a natural product, and it's bring very good benefits for your health. You don't have to worry about sickness. You don't have to be worried about spending money on like difficult diseases. You avoid all this, and you become healthier and look younger. So why not?
Yeah, but what is it that you bring to this?
Yeah, just I bring it here, just simple like this.
Yeah, I know.
Yeah.
But I mean, presumably people can buy the seed and just do it without you.
Yeah, of course. The project was introduced to Vietnam about 2012, but nobody worked with it. Even it's very good, but nobody found out that it's really good. Nobody talks about it. So I want to try to bring up the issue so that people know about the product and about its benefits. Yeah.
Very good.
Yes, very nice indeed. Thank you. Yeah, I think this is a continuation of the question before, is that why would a farmer want to plant this? Is there something about marginal land use or reduced water consumption?
We can go up to the first, here. The point, I just look at the Google map, and that's just a tiny point that our project site is. And it's in high mountainous area up above 2,000 meters. And there's a lot of land, and there's no worry about the land. But there's not enough workforce. And people in the mountainous area, they don't have money. So we have to supply everything, even food, for them to work on the project so that they can return with the products later.
So is it a case of that they can't grow anything else there, or are there some other reasons why this...
Actually, they can grow corns and some rice, but the productivity is not that high, not enough yet.
And I presume this is a much higher value product.
That's right.
Okay,
yeah.
Thank you.
And so you are planning to set up a company and you're looking for investment. So how are you going to generate revenues, income from your business? Your company?
Actually, we try to sell on our own and directly from our side to the customer, directly and by online orders only, or by we have farm and we would like to. It's about 7 hectares. Or 70,000 square meters. So we would like to, if we can, sign up with more businesses and we can expand the farming land and activities. You're welcome.
Okay, well done. Chung, thank you very much. Fantastic. Okay, so next up we have Ang. Please welcome Ang to the stage.
I'm coming.
Okay.
Don't worry about that.
All right, okay, we're not going to worry about that. There's the pink cross. There's your slide changer. And after Ang, we have An. Okay, you ready, sir? You'll get mic'd up. And so, Ang, Pete's ready. Judges are ready. In your own time.
Okay. Hi, everyone. In this the screen, you remember the Grenfell Tower in London in 2017. So many people die, many people in hospital, and many access their choice. So the people need something better. The smoke detector, it can detect the fire sooner. And it can inform to everybody to the same time. That's the reason why the firewatch has been born. So here is the difference from the firewatch and the smoke detector and flame detector. It's just spend 5 seconds to detect the fire, and 5 seconds next to inform to everyone. So here is the solution. The firewatch send to a ringing signal to the local and send the signal via Internet of Things to the people, come to the smartphone. And the market of this device is the warehouse in industry, in the apartment, in the consumer. So in Vietnam, Vietnam is a developing country, so the building so much. So just only 2 large construction companies to build 500,000 apartments in the next 5 years. So they want to they want to device to better than the smoke device. My company, Vietnam Automation Limited, estimate in the 2008 had exciting product for the railway system and building management and smart home system, and serve over 500,000 US. Using our sector knowledge, we have invested to develop a working prototype of the firewatch deliver solution for market design. That is the manufacturing price and the sale price. Just only needs 200,000 US dollars to build the marketing team and the service team, and to the dark right of the device. And the next year, the company automatic to grow up. That is, and thank you.
Perfect timing, Ang. Okay, judges.
Okay, thank you for your presentation. So I wanted to find out a little bit more about the technology that you have within your sensor. Are they new sensor technologies, or are you using existing technologies and the innovation that it's smart and it sends a signal to your phone?
Yes. The key technology here is a thermal sensor. Thermal sensor is the same principle with the thermal camera. But the thermal camera is very, very expensive. It's about 10 or 12 $1,000. But my product just only one, or maybe a half of $1,000. So this technology is only used in the military before. So in that time, they go to the consumer.
So is the intention that the fire service would be called, or how does it work in terms of having sensed the fire?
How does it
dealing
work?
with it?
How does it work? Sorry.
How does it hasten the route to putting the fire out?
Putting the fire alarm. The principle of the sensor, do you want to know?
No, it's more about the process. How, by identifying the fire early, how is it that you plan to use that information to make sure the fire is put out more quickly?
Yes, because it detects very fast the influx, the wavelength of the influx. So, and this processing and send to cloud, and the cloud send to the smartphone. That is the IoT system.
Okay, thank you. So do you actually make the detector, or is it an existing...
the sensor.
The sensor. Do you actually manufacture it, or is it an existing product?
The sensor comes from Germany. I just only to develop the PCB and the software and all the anything.
So it's the software
and the hardware.
Yeah.
Just only buy sensor from Germany and from America.
Yeah. Okay. Thank you very much.
Thank you.
Okay. Thank you very much, Ang. Right. So next up, we have An. After Ang, we have Tang. Okay. Tang's mic'd up. Right. So, An, you ready?
Yes.
Slides are ready. Judges are ready. Pete's ready. In your own time.
Good morning, ladies and gentlemen. My name is An Vo. I'm from Vietnam. I'm a lecturer in Nông Lâm University, and I have been teaching pharmacology for veterinarian students in about 20 years. And I also have experience in consulting and selling some product to the farm. So the product today I bring to you relating to herbal medicine to treat diarrhea for the piglets. So in the graph, you can see Vietnam is one of the large pork producer in the world. And Vietnamese farmers use a lot of antibiotics in the production line. It goes up to 6 to 8 times higher than in the developed countries. So abuse in antibiotic use leads to antibiotic resistance, a big problem today. And therefore, Vietnamese government contribute to release some legal document to decrease antibiotic use in pig production. So in the new situation, we need a new solution for farmers. So antibiotic alternative. Therefore, after 2 years of doing research, we are very happy to bring the stop cure to the farmers. The product is from guava extract origins, and it's easy to use as a drinking solution for piglets. And the product is already clinical tested. They prove to have the same efficacy as antibiotics. And the distinguished property of the product is from its organic origins, and it have less side effect for pig, human, and also environment. So using it means you save antibiotic for future.
I would like to have expectation, and we tend to do the licensing. With the stock boy in Vietnam market only, we have 28 million pigs, and the organic, medium, and export farm is our target. We will try to reduce 1,500 units for the first year, and the market can go bigger if we can bring to Asian region and also worldwide. So let me give you a snapshot of our achievement. We are in very early, and the technology is license ready. So we need funding for registration, IP, and we also need the partner as a distributor or the consultant to do the IP. So do you know that the antibiotic resistance costs up to 10 million people die by 2050? Yeah, so we are working to avoid it. Please help us. Thanks so much for your attention.
Perfect. Well done, Anne. Well done. Timing continues to be impeccable. Judges.
I think they're frightened. Can I ask in this, I assume guava grows naturally in Vietnam. What is it that you're going to get intellectual property protection for? What is specific in your process?
So we use guava leaf as a byproduct, but the process to extract it and to formulate into the final product is the property. That's we would like to protect. Yes.
Okay, it's noteworthy that you deal with, your product deals with diarrhea. Is that the only ailment that antibiotics are used for in pigs?
Yeah, so in the new situation of antibiotic reduce the decrease, so there are several solutions. For example, the enzyme, the herbal medicine, the oil extract, and we have the one of the solution that is the herbal extract. So not only antibiotic, but another alternative can be our competitors. Is that what you mean?
Yes. Sorry, my point was, are antibiotics not used for more than treating diarrhea?
Yeah, that's also a point. It's very promising that antibiotics in Vietnam, they use a lot for preventive methods. That's why I put in my later research that we can use an alternative treatment, so the market bigger. But we don't have the data yet.
So thank you. And you've mentioned that obviously the use of antibiotics is quite low in various countries. So what alternatives do they use in those other countries?
Okay. So you mean in the developed country? Yeah. I know they pay very much attention to the biosecurity. And to reduce antibiotic use, we have many methods, about, I think, the least 10 very applicable one. And one of that, they also use the alternative, the herbal medicine. For example, I understand in US, they have a preventive solution, a little bit similar with us, but they use for control the stress periods for the piglets. So prevention solution. Thank you.
Okay. Well done. And thank you. There's a tag team going on now with the Vietnamese pitchers. Please welcome Tang.
Yes, it's great. Thank you.
Okay. Okay, Tang, you ready for the world? Okay, so there's your slide changer. Pete's ready.
Yes.
Judges are ready.
Ready.
In your own time.
Yes.
Slides are ready.
Yes.
We have a bit of an IT issue. That's all right. We don't mind, do we?
No, not doing anything.
I haven't got any jokes.
Oh.
Have you got any jokes, Tang? Any Vietnamese jokes for us?
I don't know exactly.
I mean, it's not on the script, obviously, but you know.
Yeah, just prepare.
Okay.
Yes.
So, looks like we have a bit of action now. Bit of document recovery. We don't, right, yeah. Yeah, okay, so here we go. So, this is being streamed live across the world, right?
Yes.
So they asked me, yeah, because I'm a bit of a, do you like dancing? Because basically, you like flossing, right?
But no problem.
You ever seen an Englishman floss?
Just some picture inside. Ah.
Come on, Steve, get me out of this. Oh!
Okay. It's fine.
We were nearly there. We nearly saw the flossing. Yeah. Another time. Okay. Okay, Pete, you ready?
Right.
Okay, Ang, please, go ahead. Tang.
Good afternoon. My name is Quang from the Vietnam National University in Ho Chi Minh City. I'm a control engineer, but today my story is about the medical device with the back pain treatment machine. Can you imagine that? The back pain is the core, the disability worldwide. It's #1, and also in the WHO study, 80% the population will be get at least first time, at least one time in their life for the back pains. But of course, in order to treat the back pain, the non-surgical method here is spine decompression therapy. That therapy they help you to a little bit apply force to straighten the spine, and it helps the disc more loud, reduce the pressure in the disc, and help the body have a natural healing process. And so, the problem here, how can to apply force to spine? So it's very difficult and very dangerous for the patient. And you can take a look a little bit about the graph. And the graph here shows the therapy exercise for the patient. And so we need to accurate force control. We need to also high frequency therapy exercise. We also need to high vibration, force, and high frequency. Of course, we need to comply with the patient and the safety. And all the requirements here are put in my products. Here is my prototype, working prototype in my laboratory. And it takes 3 key technology here. At first, we apply the pneumatic muscle actuator. The second one, we apply the artificial intelligence controller. And the last, we enable for the doctor to customize any kind and any effective therapy exercise for the patient. And it's suitable for the physical condition of the patient. Using the 20 years the research on the control engine, I also found the patent pending in the US, and also the clinical test in the hospital. And the benefit here to enable for various effective therapy exercise. And the second one, accelerate the relief the pain. Next is compatible with the most patient with the very difficult physical condition of the patient. And of course, it's safe and compliant and 10 times cheaper. My next step is I need to find the partner to grow, especially the licensing, especially medical company in the US. And after that, I need to clinical trial in order to get the approval from the government, and I hope to license it in the near future. Let's contribute our better life. Thank you.
Done, Tang. Well done, again. Right on time. Okay, judges.
So I would like to find out, have you tested this product and how effective it is in kind of for using physiotherapy?
Yeah. At first, we need to follow the recommend of the therapist front. We need to design the graph to treatment for the patient. And in order to check, we need to check how about the product in the laboratory first. We need to check how about the exact force control to apply. Maybe back at some slide, and we'll show you. For example, here in this slide, we need to the blue line is the reference force control needs to apply, and the red line is the real force from the sensor. And of course, I just presented with some patient in the hospital. And with the help of the doctor, people said, okay, some people is good for test with the deep machine, another guy is not good, and we need to track. And of course, in the near future, I need to test more and more with the MRI, CT scanner, in order to check how about the quickly relief pain of the patient. Thank you.
So what is the product that you're actually selling?
My product is just a working prototype. And I intend to sell my licensing. My business is love to sell the license. That means I sell my innovation only. Yeah.
Okay, thank you.
Okay, well, I wish I'd known you a few years ago, but I've had my back screwed up already, so I'm a bit late. Yeah. What I don't understand in this is, okay, is it a one-off treatment, or is it a treatment that has to have several sessions? I mean, I've had, when I have back pain, I can take something to relieve myself, but it doesn't last very long.
Yeah, correct, sir.
So is this a one-off, or is it something that you have to have?
Normally, we need to check how about the pain. Of course, in some case, people just breathe pain. No need to use the machine. But in some case, people have some problem with the back pain, and we need to more and more effective the treatment method. Especially in here, non-surgical method with the spine a little bit stress, in order to help your body to natural healing process, in order to make it more quickly relieve pain.
So this requires repeat treatments then?
Yeah.
Do the patients have to come in several times into the hospital for the treatment?
Yes, already. This my device also sent to the hospital in order to take a little test with the patient.
Okay, thank you.
Thank you, sir.
Okay. Tang, thank you very much. Well done.
Thank you very much.
Right now, I think with all the excitement of me, I'm not even going to talk about it anymore. I didn't even announce who was next, but you're also organised. Ngoc, right? Ngoc, please come onto the stage. Welcome, Ngoc. Okay, and after Ngoc, we have Tung. Tung's ready. Everybody's ready. You're ready? Yeah. I'm ready. Judges are ready. Pete's ready. In your own time.
Yeah. Hello, my name is Ngoc. I'm from Neo Capsule, Nha Trang University of Vietnam. And my background is food technology. And this is Linh, my daughter. And like other children, she loves fast food. She loves the dessert, sweet desserts. And it links to a risk of food safety and disease like diabetes. But it's not easy to convince her not to eat this food. And we are not the only family in Vietnam that face this challenge. So that's why we need more and more new healthy products for our kids. And so that's why Neo Capsule was born. And we are going to create a range of new natural food. But now, today, I present to you our first launch, the gut-enriched instant pudding. So this is a pudding without food additive, totally natural, simple to use, but always yummy to the children. And you will get many benefits of this pudding because it is healthy and parents' time saving. So how could we do this? We use gug fruit and encapsulation technology. So gug fruit, you may not know that it is a traditional fruit in Vietnam, and it's abundant, easy to plant, contains many precious elements to life, like lycopene and beta-carotene. But this goodness will lose when you cook it. So we apply the encapsulation technology to protect all of this goodness and put it into our pudding. And you have a pudding ready to use. Our target market is the children under 10 years old. And if you know that Vietnam is a country of a growing population, you will know that the opportunity of the market is relevant. So we have started the project in 2012, and through 4 years, we have been funded by the government of Vietnam to the final product. And now what we want to do now is to do market research to understand the competition and to price the product, do IP to protect the key technology, and production pilot to ensure the quality of the product, and also the customer sampling to get feedback before launch sales into the market. And we are asking for a total investment about the $14,000. So, do you want to join with us in the journey to help our children healthier and happier? So come with us and we can talk together. Thank you.
Well done, Ngoc. Okay, judges.
Yes. One problem in this country is the labelling of the product that's the real issue, not. But can I go back? You had a number of collaborators on that slide, like NUS and Monash. What part of this process is unique to you? Yes, down here. What part is unique to what you're doing?
This is the collaboration that we established during the project from the 2012 to till now. And the most important is the bioencapsulation research group.
Right.
That's yeah, that we are in the group. Yeah, and we are having a project with the National University of Singapore, but this is not this product, but in the aquaculture.
I see.
Yeah.
So is the expectation that you would replace sugar within heavily sugared foodstuffs, or is this to be eaten on its own?
On its own. We use the gug and we transform it to powder and we put it in pudding with our own formulation. Yeah.
And you've mentioned that you use encapsulation technology. Is that technology something that you invented and patented, and is food safe?
Yes. Encapsulation technology is around of you. You can find it in your home. But, yeah. But in food technology, it is now the trend to use encapsulation. And of course, in food, we will use the ingredient, the safety ingredients for food. And what about another question?
I just wanted to know about the encapsulation.
Yeah.
Sorry, and also on what basis is it more healthy than the sugar that it replaces?
Okay. So the health impact here is that we put into the pudding the precious element from the gug fruit, like lycopene, beta-carotene, so anti-cancer and anti-aging. Yeah.
Okay, thank you.
Thank you.
Okay, thanks very much. Ngoc. Okay, Vietnamese, can I just check I haven't missed out An? We did Ang, and we did An. We've done you, haven't we? Yeah, and I thought we're okay, we're good, but we needed to check. Right, okay. You ready, Tung?
Yeah.
Come onto the stage. Please welcome Tung. Okay, right, so after Tung, we have Pham. And so, Tung, you're ready?
Yeah, I think so.
I think so. Our judges are ready. Pete's ready. In your own time.
So, good afternoon, everyone. My name is Tung from Vietnam, and I'm here today for the meeting involved with the agricultural sectors. So, Vietnam, in recent years, Vietnamese farmers have faced lots of problems involved with the redundancies of agricultural products. And as we look at the markets, the export value just for the vegetable and the fruits is about $4 billion US. But 40% of the bulk harvest is normally damaged or wasted. So the market is huge, but it still needs very important to have a good drying system for agricultural products. So nowadays in Vietnam, there are two traditional methods for drying. The first one, we use direct solar radiation, and the second one, just the electric heaters. But both of those methods have many disadvantages, especially with the low quality of the products. It means that the percentage of the vitamin and the mineral is decreased with the high temperature. So those methods are just suitable for the low-value products for export. Now, our solution is to integrate the heat pump technology inside the drying system. And our prototype show that we can keep a good quality of the products
with low temperatures. So another interesting thing is it's not yet available, this technology in Vietnam. Our business model is focused on to design, manufacture, and sales. And the market is Vietnam. The main customer is the food processing factories. So in order to reduce, to minimize the cost of the production, we have the plan to buy parts from other industry and just assembly in our company. For the team and the partners, now we have 2 scientists, 4 engineers, and another 3 partners from industrial factories. But we are still planning to look for a new and a good CEO who can lead the team. And from now to the end of this year and so far, with this CEO, we are planning to ask the funding of about 400K US dollar for, and we will use this money for further testing, for like develop the teams and something else. So if you are interested in our project, just come to see me and we will have a talk. Thank you so much.
That's great. Okay, judges.
Thank you for your presentation. You've mentioned that this technology does not exist in Vietnam. Does a similar technology exist in other countries?
Yeah, sure. This technology is not something very new or high technology. This one exists now in other countries, but in Vietnam it's not yet. So it's not like for the licensing or for the patent, but it's for the commercialize something new. Yeah.
Can you import it from abroad into Vietnam, from other countries?
Yeah, there are some company now. I know that they have intended to buy those products from other countries and sell that in Vietnam. But the problem is, if they do that, the first thing is the cost, the price is higher than ours. And the second one is we design by the requirements of the customer. For example, for another processing factories, the capacity is different. So dependent on that requirement, we will design, we will buy lots of things, we assemble, and after that, we install at that factory. Yeah.
Is there an appetite for the food dryers to actually incorporate something as technically complex and with the potential for failure as a heat pump?
With the heat pump, yeah, it's the technology inside is like we can remove the water weekly. At first step is like condense the water, remove that, and after that heat up by another heating coil. So this one, the technology is the same like a refrigeration cycle. Yeah, but just like we put together and lots of the factory now in Vietnam normally they just do that. It just do the simple thing. So they just provide the electrical heaters. Not with this technology, they don't understand much about the knowledge. So it's the domain I think we can enter the market. Yeah.
Sorry, the question I was going to carry on with then is, do you offer a service where you can actually maintain it so that you can allay some of the fears of the farmer that they're just going to buy this piece of kit that might fail and they won't know what to do with it?
I think for the farmers, normally in Vietnam, the farmers, they don't want to ride by themselves. Normally, they just want to buy the raw materials for others industry. In other industry, they will provide equipment for riding, for processing, yeah, something like that.
Yeah, I guess you had a slide there showing watermelons. You wouldn't be putting watermelons into this kit. What is the size of the actual market within Vietnam for whatever dried fruits or whatever you're doing? Because in the end, it's far cheaper to leave something, even if it is not sanitary, out in the sunshine.
Yeah, because now lots of people do that, just put on the sunshine. The market of Vietnam is huge, and now we need a lot. Now we need to improve the quality, because now from Vietnam we just do the export, but with the very low value of the products, agricultural products. So now the trend in the future, we need to improve the quality, and this technology is one of the things. We can control the quality, we can control something like the vitamins, the mineral, and other things inside the products. And with the sanitary too, because the other things, they use the cycle of the air from the outside, so they affect from the atmosphere outside.
So they're using the hot air?
Yeah. With this one is the closed cycle. Yeah.
Okay,
thank you so much.
Okay, thank you very much, judges. Tom, thank you. Okay, Pham, come along, come on. Come and sit and please welcome Pham.
Good afternoon, sir. I have some sample here.
Well, Pham's got something for you.
You don't have to eat it. You don't need to eat it.
Right,
yeah, yes, sir.
Okay. Now, after Pham, we have Yen. Yes, Yen. And do you know what? Yen is our final Vietnamese pitcher. Oh, how exciting. Right. So, Pham, you ready? Your slides are ready. Pete's ready. Over to you.
Good afternoon. I am Pham Trung Kiên from Ho Chi Minh City, Vietnam. So I want to start my presentation with one question. Do your families have the kids, elderly people, or the working people? If the answer is yes, so your family may fight with the potential problem in the bone disease. So the kids and elderly people, they have a tendency with bone because less absorption of calcium phosphate material. The working people can sometimes have unexpected accident that give the broken bone, and the cost for bone treatment is very high. So my solution is calcium phosphate material that's for bone care and bone repair. So this material we aim for to improve the quality of life. Material can be used in the meal supplement and food supplement. Also, we aim to develop for the next step for dental treatment as well as for the orthopedic treatment. So this material, as I show you on the sample here, we can control the particle size from one particle to the granule. And due to our exclusive technology, the morphology of our product is similar with the natural bone on the right and left picture. So compared with existing calcium phosphate material product on the market, so my material we can use in the food and meal supplement, in dental treatment, also in orthopedic treatment. And due to exclusive technology, we can offer the lower cost compared with the other product with the same quality. So the market of calcium phosphate material in Vietnam is very huge. And with the production price around $100 per kg, we can sell up to $500 per kg or up to $30,000 per kg for the granule form. So the advantage of my product is we are the same quality and morphology is similar with the natural bone, and we are the pioneer of calcium phosphate material, and we can offer the lower cost compared with the other product. So we want to ask that we want to transfer the technology to the calcium phosphate manufacturer. Also, to enter the Vietnam and Asian early stage market, so we ask for the first rating around $1 million to commercialize the early stage product. So the team, including me in the biomaterial engineering, also professor from material, and one dentist doctor also got the PhD degree in biomaterial, and with the business advisor, Dr. Jan Thompson. So this product can contribute to the social economics of Vietnam because we can offer very low price. So we contribute to the middle and low income people. We reduce the purchase on the national insurance health. Also, we create more jobs for people in Vietnam. So this is my contact information. I hope that everyone can support me to contribute to the economic and social. Thank you very much.
Well done. Perfect timing. Okay, judges.
You say your production technique is a low temperature technique as opposed to normal calcification and system. Do the raw not raw products, the raw materials, are they in Vietnam already, or do you have to import those?
This is a very good question, and this is the toughest question. In Vietnam, we almost import it from overseas, like from US, from UK, from Europe, from Japan, because we do not produce this yet. So this is high value for the production. So in my technology, we can produce in Vietnam with very low cost. So this is our advantage.
But you already have the raw materials in Vietnam?
Yes.
Okay. What is it your intention to sell? What's your business model? Are you a factory that produces and sells the product, or are you selling the technology to someone else?
I don't sell the product. I license my technology to the calcium phosphate manufacturer. Because to sell product, this is the big story. I cannot do it alone with my team. So I'm the researcher. So I just have some technology inclusions, and we produce at the low temperature. So that's why the cost is reduced compared with the other competitive product. So we want to transfer this technology to the calcium phosphate material.
So you talked a little bit about your technology. Is it novel, or are similar technologies exist in other countries?
I think this is the novel technology, because you know that the other product from other companies, they get calcium phosphate at high temperature. But remember, our bone is forming at the low temperature, 37 degrees for 9 months. So my technology, it mimics the formation of the bone. So we do it at the low temperature. That's why the cost is very lower compared with the other product. And the morphology is similar with the natural bone. The other products from the other company, they don't have the morphology same as natural bone. So my calcium phosphate material can be easily absorbed by the natural bone, and we can make the bone healing faster.
Okay, that kept them quiet. Well
Thank you very much.
Bam. Thank you. Okay, while Pham takes his samples. Right. Please, everyone, a huge welcome for Yen, our final pitcher. Come on. Waiting all that time. Okay, so our last Vietnamese pitcher. Judges, you ready? Pete's ready. Your slides are ready. Over to you, Yen.
Good afternoon, everybody. My name is Ying. I come from Southern Horticultural Research Institute, Sopri in Vietnam. Now, today I want to tell you about the $600 million fruit. And that is my product. That is the white flesh fruit variety LD17. So my institute, we developed a new fruit cultivar. And Sopri commercialized this in domestic and international markets, launching new products on an 18 months cycle from an 11-year new product pipeline. And in 2017, Sopri shone right for a new red variety that is outright for $220,000 USD. One of Sopri protest partners used a licensed model. Last year, PFR received 17 million of the revenues from one variety of the kiwi fruit. In the future, Sopri will move to the license in fruit variety rather than sell. So now in Vietnam, we exported only round fruit each year, more than 1 billion USD. Only white less round fruit, we get 600 million US each year. Now, in Vietnam, we grow only one variety for the white flesh variety. That is we grow many years ago in Vietnam. So that now it's affected with the cancer disease. That the disease very serious in Vietnam. So that we want to develop another variety. That is, we want to replace the assisted variety. This we developed the new white flesh variety. That this so resistant with the cancer disease. Also, it increases the food quality, and it can save like longer store, up to 60 days compared to 35 days with the on variety. And now, this year we go into certificate and national IP and give the license to company. And if we give license after third year, we can get the royalty. And after that, we can transition from subsidy to revenues. Now, we embark to growth, security, expertise, and job indicate export sector. And the ads, we're looking for connection. We need to connect with and learn from global players. And we are looking for the key partner for license strategy and valuation and license agreement. Thank you for your attention.
Well done. Okay, judges, please.
So you've developed a new variety. I wanted to ask, how do you keep it protected, the intellectual property, or do you just keep it secret until you license it out?
Now we keep secret first, And after that, we had to give for the test variety. First, we went to test in the Vietnam. And after that, we looking for the partner to test in the international IP. Yeah.
You mentioned a number of very positive points about your new variant of the fruit. Why would the farmer, though, want to plant it? I appreciate that the user will receive benefits, but why would the farmer be interested in selling it?
Because now, you know, in Vietnam we have the white flesh variety that very old we grow many years ago in Vietnam. The farmer the orchards that is more than 10 years. So now it infected with the canker disease. That the disease, I say that is very serious in Vietnam now. They have to use a chemical to control this one. But for the exported, if we use the chemical that cannot export, so that we want to develop the new variety that is resistant with the disease. Yeah.
Okay, thank you.
Okay, does it involve genetic modification?
Yeah.
I mean, in this country, for instance, GM foods are banned. So what technique did you use to develop the variety?
Yeah, this the variety we developed by the traditional hybridization, and after many hybrids we select, we screening with the canker disease, and we grow and we test with the canker disease in the field also.
The other thing too is a lot of fruit gets spoilt in transport. Is this as good as the one it replaces? Does it get bruised more easily?
Yep.
It is as good?
Yeah.
Yep. Okay. Thank you very much.
Yep.
I'll throw some around and find out. Anyway, thank you.
Okay, thank you. Thank you very much.
Okay, Yen, thank you. Well done. Ladies and gentlemen, please give a huge round of applause for our Vietnamese pitchers. Woo! Okay, can we also give an enormous round of applause for our judges? It's hard work. Well done, guys.
Perhaps I can thank, on behalf of the judges, all of you who presented in my native language. It mustn't be quite difficult, especially in this building, so well done.
Come on, thank you. Huge round of applause there. Okay, so now, if I'm not mistaken, Hannah, it's lunchtime.
It is at 1:15, so please hang around, have a cup of coffee, have a cup of tea, and then we can go downstairs at 1:15.
Okay, great. So we're ahead of schedule, as we always are with this cohort. If anybody would like to use a prayer room, if you go down to reception on the ground floor and turn left, the room at the end is available. Can I also please thank our film crew, Pete, our timekeeper, our AV support, and Gideon. Please, thank you very much to all of these people. Okay, dinner's served at 1:15 and lunch will be finished at 2:30. Thank you, everybody.